Test, test. Test. Test.
This is the hearing of Budget Subcommittee number 1. I am not Assemblyman Dave Jones. I'm Assemblyman Wesley Chesbrough. Dave Jones was unable to be here today, and I am chairing in his stead. We also have a replacement member of the committee who will be joining us later to add on to votes or to participate as he's able, and that's Mr. Blumenfield. We will take roll once we have a quorum. But let me say that, as you all, I think, know, the March 24th hearing on the cumulative impacts of adopted and proposed health and human services cuts ran quite long, and you all hung in there quite tenaciously with us. We appreciate that, but we were unable to get to part 2 of that agenda, and it was a very important part. I don't want to restate everything that I said at the last hearing. However, it is important to point out again that this Sub 1 hearing, the beginning of today's agenda, is an unprecedented effort in its coverage of issues across health and human services, which is appropriate to addressing the impact of approved and in place as well as proposed budget reductions. Families and individuals are touched by multiple programs across assistance categories and lines, so it's not just one impact on one person. When programs are reduced, multiple blows hit the same people, which is what we're interested in considering in this year's governor's budget, particularly in the context of cutting the safety net, the cutting of the safety net that already occurred in 2009-2010. Understanding cumulative impact is essential if any of us are to govern responsibly and honorably. Significant program reductions have already impacted and are impacting millions of adults, children, disabled, sick, and elderly California residents. Our most vulnerable have felt the impact of these reductions, and that's what we've asked the administration to testify to today. We want to understand the nature of the analysis of human impact that went into the development of these proposals. Was there thorough, in-depth, detailed analysis of how people would be affected? And if not, why not? This governor and this administration are compelled to answer this question, and I have to say that I was at times dissatisfied during the hearing last time when the simple answer was we had to reduce the budget. You know, we have a responsibility far beyond our fiscal responsibility. Yes, the bottom line is we do have an obligation to keep the state fiscally sound, but we also have an obligation to look the truth in the eye and really understand what the impacts are, and we can't turn our backs on that. So I really have to insist when we call representatives of state agencies and departments before us that we understand that there has been some attempt to determine what the impacts are, not simply what the savings are. We all know that budget's built around dollars, but our California budget is also about real lives, real families, real challenges, and real desire for people to live in the least harmful environments. We delayed it until today, and I want to thank the representatives from the departments and also the responders who stayed around to clear through the many hours of the previous hearing, but are here with us today to discuss a critically important subject that is a foundational concept for health and human services budgets, that the needy and vulnerable are served through multiple overlapping programs. When we cut in many areas, we affect the same families and the same individuals who are also dependent on a safety net services really to survive, to eat, receive health care, pay rent, and care for their children. So we'll work through each of these scenarios, these 3 scenarios, and hear about cumulative impact, first from the administration's perspective and then from the selected responders. There will be no public comment for this section as it's a special oversight item. We will have testimony on the individual budget items that follow later on in the afternoon. And I do apologize. I know there were a number of people who had hoped that we could reverse the order and take some of the budget items earlier, but I'm afraid the complexity of today's budget or today's agenda means that we will need to pretty much stick to the game plan. You are welcome, by the way, to submit written comments if you're unable to stay around long enough to testify on any of the budget items we'll be hearing later on in the afternoon. That being said, the first scenario is low-income family served by CalWORKS and Medi-Cal. Mary has 2 children and is on CalWORKS. 1 child is a disabled adolescent receiving SSI benefits and IHSS services, and the second is a child under 2. the family receives Medi-Cal services. I'd like to ask representatives of Medi-Cal in the Department of Healthcare Services, CalWorks in Department of Social Services, and in the Department of Mental Health EPSDT programs to come forward and give us their analysis of how this scenario would play out. Thank you for being here.
Good afternoon, Assemblymember Chesbrough. Vanessa Baird with the Department of Healthcare Services. Unfortunately, Mr. Toby Douglas, who did the first part of this hearing, was unable to be here today. I hope that I can provide all the information that you're requesting. Under this, what I will do for the Medi-Cal component is that I'm going to address with each of these case scenarios the impact on the family's eligibility and the benefits. Under the first scenario with Mary and her 2 children, for the current year, their eligibility was unaffected. The reason being is we did not implement any reductions to eligibility. We had started down that path but had to reverse with the passage of ARA in 2009, which required Medicaid programs to fulfill maintenance of eligibility requirements related to standards, processes, and procedures for determining eligibility. So as a result, that did not change. So since Mary is on CalWorks and she also has a daughter on SSI, SSP, and because we did not implement any changes to eligibility, in this case, their eligibility continues in the current year, and they are not affected by eligibility changes. However, where things do change is in the benefits area. So with the benefits that were eliminated in the current year, they are referred to as optional benefits because states have the option to provide them or not because of that does not denote what their importance may be to beneficiaries, but we implemented 9 optional benefit reductions. For the 2 children, because of the way that we implemented the reductions, children were unaffected by them. However, Mary, the mom, would be affected. So to the extent that she would have otherwise sought benefits such as dental, acupuncture, audiology, speech therapy, all of the 9 benefits, those services, for the most part, would no longer be available to her. For dental, we are required to provide for federally required adult dental services. So if, for example, she needed an extraction, if she sought emergency care for dental pain, if she needed biopsies of oral tissue, those things would continue to be covered.
So you're saying some dental services are still offered, others were considered optional and were eliminated in adult Denti-Cal?
Yeah, the preventive dental care is what was eliminated. We are still required to provide those. We love acronyms, FRADs, but the federally required adult dental services, but it's not preventive care. Some of the optional benefits may have also been available if Mary is able to obtain them through a physician, but admittedly, you may not find many physicians actually providing these services. So for the most part, she's no longer able to access those services. So for the current year, with this particular case scenario, the primary impact is mom losing access to those optional benefits. For the proposed changes is where it starts to get very complicated. There's different things that are coming into play here. We have the reductions that will happen if the trigger is pulled, meaning that we are not able to secure the federal funding that we are seeking. But that's also played out with what we're currently analyzing with regards to health care reform, which passed just last month. Under health care reform, there is another maintenance of eligibility requirement. And although I want to point out the state is seeking federal flexibility from these maintenance of eligibility requirements. What we are doing in the meantime is analyzing this, and in May revise we should be able to discuss what in fact any changes we might have to make if we are not able to get that federal flexibility. It means that the eligibility reductions would not go into play. Under ARA, if we violate the maintenance of eligibility requirements, we lose that increased federal match. Under health care reform, if we don't meet the maintenance of eligibility requirements, we lose the entire federal match. So it's obviously a very critical thing that we're going to have to consider. Saying all of that, with the reductions that are being proposed, one of them is reducing the 1931B program, which is there's many past eligibility. This is one of our mandatory categories.
And which family member or members are we talking about here? I want to make sure we stay focused on.
This would be the mom and the kids. The daughter also, the adolescent daughter also has eligibility because she is receiving SSI payments. But under the 1931B, we were proposing to scale it back to the income eligibility to the CalWORKS levels. Because mom is on CalWORKS, it means that, again, the family is unaffected. And if the daughter continues to maintain eligibility for those SSI payments, the adolescent daughter, she also, again, is maintaining eligibility. So in that regard, there are no changes to their eligibility with the proposed reductions. What's very tricky about all of these is that if other things happen in family circumstances that are not described in the scenario, then potentially the family could be affected. But as the scenario describes, they would not be. Then we get to the benefits, where under the trigger, we would eliminate an additional 9 optional benefits. Again, the children would not be affected. They would continue to be able to receive those services if they need them. But mom, again, would be affected by these services. So we have hearing aids, physical therapy, occupational therapy, orthotics, outpatient heroin detox. That list of services, to the extent that mom might need those services, they will no longer be available to her unless she is pregnant, or if some of these services are, again, provided by a physician. If by some means mom loses her regular Medi-Cal eligibility and still needs family planning services, because one of the proposals is to eliminate the Family PAC program under the trigger, she would only be able to get those services through Family PAC to the extent that Department of Public Health still continues to receive an appropriation, or she would have to private pay, find some other means to get family planning services. One of the other things that is part of the package is a proposal to have $750 million in savings as a result of looking at various alternatives that relate to possibly implementing co-payments as the family seeks services, payment of premiums, utilization controls. Premiums, which is one of the things we're looking at, is another subject that comes under the maintenance of eligibility. If we say that we would impose a premium, and for someone to maintain their Medi-Cal eligibility, they have to pay that premium, that would be a change in standard process and procedure. So again, that something such as that would be have to be considered under the new requirements under health care reform. So those are the major impacts that this family will feel. I realize I've glossed over it, and it in no way really describes the human impact, but this is technically how this particular family would be affected in Medi-Cal.
Well, I think we, at least with the time we have available, have begun to draw out of you, and I hope the other departments' representatives, the human face to this, to these decisions. So that is helpful. Thank you. Next, I'll call on the representative of the CalWORKS program. The Department of Social Services, I'm sorry, there's a whole range of DSS programs.
Right. Chairman, thank you. My name is John Wagner. I'm the Director of the Department of Social Services, and we, as you indicated, will...
Welcome. It's good to have you here.
It's good to see you. We'll touch on the CalWORKS issues, some of the child welfare issues, and others. 4 quick points before we answer the very specific scenario questions. One, thank you for looking at the scenarios across departments and across programs. To be truthful, the budget process of which we are all a part is not conducive to having and knowing exactly the full impact of some of this. I think states like California are going through this very analysis with something like federal health care reform, something we're cautiously optimistic about, but still doing an analysis because it touches so many of the families we serve and crosses so many of the departments. So those are 3 points I'd like to make. The other is that we, as Chief Deputy Bob Garcia, and I have full faith in all representation that we have ever sent to the committee to testify on these hearings, testified to last time. We are open and committed to viable options as we explore these scenarios. So to get in the scenarios, and specifically CalWORKs, as you've identified, Bob Garcia will walk us through the impact of the proposals.
So beginning with Bob Garcia, Chief Deputy Director of Social Services, as the Director mentioned, many of the clients served by, that in this scenario and in all of our programs are served by multiple programs. So when we make a change in CalWORKs, oftentimes it affects people who are also receiving IHSS or also receiving Children's Services or SSI, SSP, or other programs. In the case of, I think that it's difficult to know exactly what the cumulative effect of reductions would be on a family like the family in Scenario 1. But we'll talk about a couple of variations here in a minute. First, with respect to the Prop 10 funds, if the Prop 10 funds were redirected to children's programs, as was proposed in the governor's budget, it would likely reduce services available in the community and reduce options for families. We don't know exactly what effect that would have on this particular family, but certainly would reduce options for services. There are studies that indicate that poverty is a risk factor for child abuse. We certainly acknowledge that. This family and most other families in the programs that we administer fall in this risk category already. We don't know what the proposed reductions might, or how the proposed reductions might affect these risk levels, and we're at this point really not able to project whether or not it might lead to additional kids in foster care. But getting into the specifics of the scenario, and beginning with the changes that have already been adopted, there was a 4% grant reduction for CalWORKs, and there was an elimination of COLA. Those certainly had an effect of reducing the income for this family. Now, it's important to note, too, that families come to our programs through a variety of circumstances. So what we've done here is we've laid out a couple of variations that wouldn't be unlikely kinds of situations that a family like this might be in. So kind of beginning with the first variation, if it's possible that the mother is the IHSS provider, in this case for a disabled child, and we've assumed, and for the cases of the numbers I'm going to go into a minute, that the child receives an average number of hours of services, which is about 86 hours of IHSS services, and that the payment level is at the average state wage, which is about $11.50 an hour. And then there's another possibility where the mother is not the IHSS provider, but maybe works outside the home for something less than 10 hours a week, so there isn't a huge amount of income that the family is getting from outside the home. So with changes already adopted, this family's income could be as high as $2,137 a month if the mother was the IHSS provider, or possibly $1,890 a month if she was not the provider but was working some minimal amount outside the home. Now, this level of income includes CalWORKs benefits, SSI benefits for the disabled child, food stamps, and some earned income, again, depending on whether or not the mother is the IHSS provider. With the proposed reductions, there would be a 15.7% CalWORKs grant reduction. There would be elimination of IHSS for those with a FI score below 4, and IHSS wages would be reduced to minimum wage. There would be an SSI COLA, most likely effective January 2011. Doesn't look like it's going to be a very large COLA at this point. With these proposed changes for 1011, we would assume that the child would not qualify for IHSS. So the mother would have to become the provider, and she would not be paid for providing services. the family's income would decrease to $1,590 a month, and that is a reduction of from $300 to $570 per month, depending again on their circumstances. And then with the contingency reductions that are also included in the budget, the CalWORKS program and the IHSS program would be eliminated. In that case, this family's income would drop pretty dramatically. It would go to about $1,170 a month, which is a $720 to $967 per month reduction in benefits. So their income would be affected pretty dramatically. Yeah.
Presentation. Okay, let me next call on the representative of the PSDT program, the Department of Mental Health.
Thank you, Mr. Chair. My name is Stan Bajoran, Acting Chief Deputy Director for the Department of Mental Health. Director Mayberg wishes he could be here. However, he's in discussion with representatives of the federal government to bring in additional funds for our veterans in the state of California. One thing to make sure that everyone understands is that the EPSDT program is a federally entitled program to provide services to low-income children under 21 years of age. The governor's budget proposes an increase in the EPSDT program and does not propose any reduction in services for EPSDT. The proposal in the governor's budget is to shift $391 million in funds from the Mental Health Services Fund to reduce the general fund participation in that program, but there is no reduction in services for EPSDT clients.
Okay, well, I thank you very much, and well, I obviously would like all of you to remain available. I'm going to ask the responders to come on up and fill your chairs. We have Frank Mecca, the County Welfare Directors Association, Mike Harold, the Western Center on Law and Poverty, and Kelly Hardy, Director of Health Policy for Children Now. And we will ask Mr. Mecca to lead off.
Thank you, Mr. Chairman.
I sort of feel like we just got all the threads, but they're not necessarily woven together. I'm hoping you all can sort of weave those threads together for us.
Thank you, Mr. Chairman. I'm Frank Mecca. I'm the Executive Director of the County Welfare Directors Association, and we really appreciate the opportunity to try to weave the threads together. As the level of government that on the state's behalf implements and administers the entire gamut of human services programs, we do see firsthand the multiple impacts of budget reductions that have been taking place over the last several years and those that are proposed on the very vulnerable people that we serve. Our conclusion is, we'll start with the end, that the cuts affect the safety and well-being of children in our state in dramatic ways. It diminishes the prospects for family self-sufficiency and for economic recovery in equally dramatic ways. And the impacts on children and society aren't just a short term, they'll last a generation at least. With respect to the scenario in play, I think the prior witnesses gave you a good technical sense of the way the families could be affected by the cuts. I will very briefly try to address some of the implications of those cuts as we see them and make some assumptions about the scenarios along the way. With respect to scenario one, the adults in this scenario is one of a high percentage of adults who are now exempt from welfare to work requirements for the current year and the budget year in light of a $750 million cut to employment services that was enacted last year. Because of that cut, the state did exempt people, CalWORKS recipients with young children, from welfare to work, not because that's necessarily advisable or good, because it certainly undermines our ability to become self-sufficient, but because in the absence of $750 million worth of child care, transportation, and other supportive services, it was believed rightly that folks would not be able to remain, to become employed. So in this case, the family in question clearly will be exempt, And as counties implement the reduction, we would expect a person in this situation either to voluntarily disenroll or has a high likelihood of the county disenrolling them as they get further into the year and find their welfare to work resources limited. Now, assuming the CalWORKs program isn't eliminated, and of course that depends on what would happen in the proposed trigger reductions, the exemption from welfare to work requirements is probably a good thing for Mary, since we too would assume that her child would no longer be eligible for in-home supportive services, and now she'd be solely responsible for that child's care. We would point out, it was our opinion then, it continues to be our opinion, that the basis for making the cuts, which of course are currently enjoined by the courts, don't necessarily relate to acuity. So the fact that that child is no longer eligible for IHSS doesn't necessarily mean that the child doesn't have very significant care needs. In fact, we know, and I think it was the basis for legal action, that there are some of the most needy IHSS recipients are those that would be affected by that proposed cut. The combination of the cut to welfare to work services and IHSS services for this family virtually ensures that they will not be able to become self-sufficient in the short or the long run. We are also very concerned that cuts like those proposed and the dramatic decreases in income that Mr. Garcia laid out will not only push families deeper into poverty, but will increase the incidence of children moving into the child welfare services and foster care system. Numerous studies demonstrate a strong correlation between poverty and entrance into the child welfare system. One study showed that children from families with incomes below $15,000 per year were more than 20 times more likely to be in the child welfare system than those that were not. Another study found that reductions in TANF benefits nationally are the second largest contributor to foster care caseload growth, followed second only to female incarceration as the #1 factor. I think it's important to point out that this doesn't mean that poor people are inherently more likely to maltreat their children. It's to say that the ability to take care of the basic needs of your children and therefore avoid neglect is obviously and intuitively related to some basic decent standard of living for the provision for your children. So this isn't about character. This is about basic economic ability to care for children. Once in the child welfare system, the governor's $120 million veto out of the child welfare services program will make it more likely for that family to will make it less likely for that family to be able to reunify, and more likely that the children will remain in foster care for quite some time. The $80 million general fund, about $40 million federal funds, is having very significant negative impacts in counties. We've heard from many counties that they've had to virtually eliminate or entirely eliminate their voluntary family maintenance programs which provide services to people to help them be able to address the issues that prevent them from meeting their children's needs and avoid entrance into the foster care system, or to expeditiously reunify children. Other programs designed to prevent abuse, support families, and avoid foster care placement have also taken deep cuts, such as state family preservation and the Supportive and Therapeutic Options Program. So we will have some significant offsetting costs. Foster care average costs, as you know, and as all the members of this committee know, are higher than supporting children in the CalWORKs program. I think it's also important to note that for most people in the child welfare program, two of the most important and problematic barriers for them to get their children back are housing and employment. And Mary, in this case, has lost welfare to work services in the CalWORKs program. So the deep reduction in her grants and about a 50% reduction in the family's income makes it more likely for her to have children involved in the child welfare program. But the elimination of welfare to work services is going to make it incredibly difficult, if not impossible, for her to be able to put a household together to be able to get her children back. And as a result, those children are possibly in foster care for the remainder of their majority. The overlapping issues are numerous, and I've pointed out this morning just some of the major ones, and I think the other witnesses on the panel will draw some additional. I'd just like to conclude with a statement of serious concern from your administrators of human services programs, not just about the impact of the cuts to Mary today, but the impact to her children and to the impacts to a generation of children. A recent study looking at children who lived through post-war American recessions into their adulthood found that children who fall into poverty during recessions will live in households with lower overall incomes. This is a quote from the study. Will live in households with lower overall incomes. They'll earn less themselves, and they'll have a greater chance of living in or near poverty. They will achieve lower levels of education. They'll be less likely to remain to be gainfully employed. Children who experience recession-induced poverty will even report poorer health than their peers who did not fall into poverty during recessions. These differences will persist for decades into their adult lives. And so we appreciate the opportunity to testify today, and we look forward to working with the administration and the legislature to preserve critical services, not just for the most vulnerable people in our society, but upon which our state's recovery is largely dependent.
Thank you very much, Mr. Mecca. I think we have a quorum. How much is quorum for? So if you will hold on just a moment, Mr. Harold, we'll call the roll.
Chesbro?
Here.
Bell? Here. Delatorre? Emerson? Here. Nistandy? Here. Jones?
Quorum is present, and we'll go back to next calling on Mike Harold, the Western Center for Law and Poverty.
Well, this microphone. When did you add this? I thought I'd begin with some perspective. Over the last 12 to 18 months in California, we've added 1 million people to our food stamp rolls. We've added 100,000 families to our CalWorks rolls. That's more families than some entire states. We have added 1.3 million people to Medi-Cal. We've seen a 41% increase in the number of people on general assistance in our state. Our safety net works. It was there for families when we hit the biggest recession we've seen in 70 or 80 years in our country. And I think what I would say overall, as I get into the more detail, is many of the proposals cumulatively would eviscerate that safety net, would have eliminated the opportunities that are being provided for families by our state right now and by the counties who provide those services. So I think overall, it just kind of is a little bit stunning to think that, I mean, I've never seen better evidence in my entire life of the need for a safety net than now, and to think that we're considering cutting big holes in it just seems completely backwards to the evidence that we're seeing every day. I'm going to kind of take off where Mr. Mecca finished off talking about Mary a little bit, and I'm going to assume that her IHSS job is over. She's no longer able to care for her family through IHSS, and that income has been eliminated. From the appearance of this family is probably going to be exempt from welfare to work requirements, either because they're caring for a disabled child at home now, or because, as Mr. Mecca mentioned, they are exempt from welfare to work under the provisions of ABX 4 from last summer that exempts families with children under the age of 2. So in either case, this person is likely to lose all of their welfare to work services, transportation, child care, all of the things, education, all of the things that might help this mother become employed and leave the assistance permanently. So this family is probably now getting about $561 a month on CalWorks. That amount, if the governor's 15.7% grant cut went into effect, would be reduced by about $88. So they would, under our estimation, go down to about $473. Now, if the trigger's pulled and the CalWorks program is completely eliminated, of course, this family's income under CalWorks would go to absolutely zero. Now, That, in turn, would probably make the family eligible for general assistance at the county level. But that benefit level at its maximum for a family is, I think, $387 a month. So you can see we're talking about at least a $200 drop between what they currently would receive in CalWORKs and what they might be able to get in general assistance. And obviously, this would be an enormous cost shift to all of the counties of the state of California. I think the LAO projected at their previous hearing a $1.9 billion cost shift to counties from that. This family also is continually, the SSI recipient and the child who's disabled has also seen their grant substantially cut. Last year, they were getting a grant of, beginning of 2009, of $683 a month would have been the maximum grant for this individual living in the household of another. But by the time all the grant cuts from last year and the governor's proposed grant cut this year go into effect, this person is probably going to have a SSI grant level of about $607 a month. Now, I would note, some of the CalWORKs grant costs would get taken, you would get it back a little bit on the food stamp side, but you don't get any of that back on the SSI side because those families are not eligible for food stamps. So that loss just has to be absorbed by the family, and there's nowhere else to get the money from. The Department of Social Services mentioned they weren't sure about what the overall poverty impacts would be, but we actually worked with the Center on Budget and Policy Priorities of Washington, D.C. Analytic arm, and they looked at what the impact would be to California if the governor's proposal and the trigger to eliminate CalWORKs entirely happened. And their conclusions were rather shocking, I thought. 190,000 children would be dropped into deep poverty. Now, deep poverty means that the household income is less than 50% of the federal poverty level. So we're talking about an income in the range of under $9,000 for a family in that scenario. An additional 170,000 children would see their family income drop from above 75% of the federal poverty level to between 50 and 75% of the federal poverty level. And an additional 140,000 children would see their income drop from above 100% of the federal poverty level to just above 75% of the federal poverty level. In total, we're looking at half of the children in the program having significant drops in their income and living below the federal poverty level, which is fundamentally the purpose of the CalWORKs program, is to help lift families out of poverty. In previous hearings, the department has also argued that that they don't see a measurable impact in homelessness among the CalWORKs population. But we believe that if they looked at data that predates the time in which the recession really began in 2007 and compared the homeless assistance program data to that in 2009, when we did that and the welfare directors did that, we saw a 36% increase in the number of applications and benefits that were received. And let me remind the committee that this benefit is limited to once per lifetime. So a family who has previously had an episode of homelessness cannot come back into the program and access it a second time. So this increase is reflecting those families who are using it for the very first time only. And just to underscore what's going on with CalWORKs families and poor families in our state, the Department of Education is now reporting that we have seen a doubling of the number of homeless children in California over the last 2 years. CDE is reporting that in the last fiscal year, 08-09, 288,000 children in California were attending schools in California and were homeless. We have a 160% increase in unsheltered kids in the last 5 years alone. So this research, and the research shows, much like we see for children who live in severe poverty situations and recessions, that homeless children are severely impacted. They have lower achievement, academic achievement. They're more likely to be in special education classes. They have lower intelligence measurements. They are more often to fail classes and more often to drop out. And homelessness is not limited to just CalWORKs recipients. SSI recipients also are homeless. A major study in Los Angeles a year and a half ago found that we now have 3,000 to 4,000 homeless seniors on the streets of LA County on any given night, and 2/3 of those recipients are either getting Social Security or SSI, and yet are still so poor that they would have to be homeless, that they're still homeless. I think that gives you a broad overall sense of what we would see as the significant impacts of these cuts, and not to mention that if we eliminate the CalWORKs block grant, we lose $3.7 billion out of the California economy at a time that we absolutely cannot afford it. Thank you very much for your time.
Thank you, Mr. Harold. Next, I'd like to call on Kelly Hardy, who's the Director of Health Policy for Children Now.
Thank you, Chairman and members.
Make sure that mic is on there. Yep.
Thank you. I'm Kelly Hardy with Children Now, a research and advocacy organization seeking to put children at the top of the public policy agenda. We come from a whole child perspective where, as has been mentioned by previous witnesses, the healthy child is much more likely to succeed in school and later in life, and to contribute to California and to the economy. I want to briefly speak about the impacts, the potential impacts on the family from Medi-Cal Prop 10, and then also dental impacts. The context here is that, according to the UCLA Center for Health Policy Research, over 400,000 children lost coverage due to the recession, lost employer-based coverage because their parents lost jobs between 2007 and 2009. And as Ms. Baird said, many of the governor's original proposals would be impacted by the health care reform maintenance of effort. However, the original proposals would have jeopardized children and adults in optional categories of Medi-Cal, and also proposed cost-sharing increases and other unnamed increases in the $750 million general fund category that's unclear at this point and is hopefully off the table. The original proposals from the governor also proposed to either cut entirely the Healthy Families Program or reduce it by back to 200% of the poverty level. That's the sister program to Medi-Cal, and if Mary was lucky enough to get a higher paying job or get some money, more money coming into the family, she would find that there would not be any low-cost program there for her children. The effect on Prop 10, if those funds were diverted, Prop 10 is the largest provider of preventive dental services for children in California. And if those funds were jeopardized and diverted, they would not be able to provide the kind of services that may now be available to the 2-year-old in the family. Continuing on the dental theme, as Ms. Baird mentioned, adult dental benefits were largely eliminated except for the federally required FRADS benefits. And preventive dental care is some of the most cost-effective care that you can get and really makes a difference in the state budget. In addition, if a parent doesn't make an annual dental visit, children are 13 times less likely to get an annual dental visit. Children's preventive dental care saves the state between $8 and $50 per dollar spent on preventive dental care. Thanks for the opportunity to testify today. When we have so many new opportunities and tools through healthcare reform, it would be a real shame and would be wasteful of the taxpayers' dollars to move backwards on children's health coverage. Thank you.
Thank you all. Let me just say I was sort of making a little list in my head, and there's a few things that weren't mentioned either by the agencies or by our responders. And, you know, the secondary impact on healthcare access as a result of loss of providers from Medi-Cal rate cuts, providers that were previously providing children's dental that could afford to do so in combination with adult dental, but when you eliminated adult dental could no longer maintain the operation simply with children's dental, so had to close down. And the cuts in elimination of state participation, for the most part, in clinic funding means that some health clinics have closed. So that's not just the question of eligibility or funding directly for the recipient, but whether or not there's a provider available to go to be served by. So those are, I guess, tertiary or secondary impacts, but obviously just as severe if doesn't matter if you got your Medi-Cal eligibility if you can't find a Medi-Cal provider, or if you have a child who's eligible for children's dental and there's no one offering that service and that's accessible to you. So thank you very much. We will go to our second scenario, which is a senior disabled recipient named Ed, who is 70 years old and receives SSI, SSP, and IHSS services. His wife, Linda, is 65 years old and receives adult day health care services. Both once received services through the Area Agency on Aging. And let me start with the Department of Health Care Services to, again, provide the initial analysis of the scenario.
Thank you, Assemblymember Chesbro. Vanessa Baird, Department of Healthcare Services. For Ed and Linda, they are a family that receives SSI SSP, which is one mechanism that gets you, it's a mandatory eligibility category. So as long as they continue to receive that SSI SSP, which I'm going to presume they will at this point, they will continue to be Medi-Cal eligible. Because they are adults, then they are subject to the optional benefit reductions. So again, there may be services that they normally would have received before the current year reductions, which are no longer available to them unless they can either find a physician that would provide some of them, or they come in a limited scope, such as the limited dental benefits I described. You're correct in what you just said a couple of minutes ago. I have to acknowledge that with the reductions, it is pulling at the infrastructure for healthcare services throughout the state. So it is not always possible or easy to find some of these services that they might be able to access, even if they are willing and able to pay for some of them themselves. One other thing I want to acknowledge in the current year situation before I go on to some of the proposed reductions is that given that Ed is receiving IHSS services and his wife Linda is receiving ADHC services, that indicates that they certainly have some conditions where they may be medically fragile and may be at risk of placement in a nursing home. And to the extent if the couple is placed in a nursing home, then that will also affect their that will affect their SSI SSP payment, and so there is that impact as well. With regards, again, still in the current year for benefits, the wife Linda currently receives ADHC services. There were several proposals or several changes that we were to implement this year for the ADHC program, but we were enjoined from two of them, one being changing the medical criteria to target the most medically fragile. The reduction or placing a cap on 3 days a week was also enjoined. The one change that did go into effect is that we are now having Department of Healthcare Services staff do on-site TAR reviews. So I can presume that Mary, if she is receiving ADHC services today, either has undergone such a review and has been determined that she does in fact need these services and will continue to receive them, or that she may be subject to such a review, whereupon it is possible that department staff may approve the services, they may modify it, they may ask for additional information, they may change it, they may deny it. So depending upon whether or not Mary has received a review will determine whether or not her ADHC services may change. Interestingly, if Ed or Linda actually were in a nursing facility, then they would be eligible for those optional benefits because that is an exempted category. So those services would be available to them if they were placed in a nursing.
Let me make sure I understand. The federal government requires that we provide those so-called optional benefits if a person is in a nursing home.
Yes.
Okay. Thank you.
Then we come to 2010-11 and the proposed changes. Again, this is something that we will need to be looking at in light of healthcare reform, and we'll be coming back in May revise to determine what reductions may happen. If the trigger reductions become necessary, one thing again I do want to point out, if the family continues to participate in SSI SSP because of that mandatory category, they will continue to be Medi-Cal eligible. If other things happen in that family that affect income or they lose SSI SSP, things can certainly change. Medi-Cal eligibility is extremely complex, and you can become eligible in many different ways. Some might think that's very convoluted, but you can also view that as a series of mini safety nets. And with the proposed reductions, if they were to go into effect, then a lot of those safety nets would be removed, and it removes the kind of options that would be available to Ed and Linda for continuing their Medi-Cal eligibility. But if they, at this point, maintain SSI, SSP, they will continue. Again, with the additional optional benefit reductions, there would be that many more services that would not be available to Ed and Linda. And it could significantly affect their ability to maintain, particularly if they're living in their own home. They'll still continue to have the minimal dental services. They'll still be able to get the services if they can find a physician willing to provide them. But it's going to become increasingly difficult as more benefits are reduced. It's difficult to determine the exact impact on Linda. We do have a proposal for ADHC elimination, so those services would no longer be available to her if that were to go through. But knowing what will happen will depend upon a lot of things. You know, what her medical condition is, how much self-care can she provide, is her husband Ed able to take care of her or other family members, and what other community resources or family members can they rely upon. So it will certainly present a challenge, but it is difficult to know exactly what could happen. The worst case scenario is that she could in fact wind up in a nursing home.
Thank you very much. We'll now go to Department of Social Services to talk about the impacts of SSI, SSP, and IHSS.
Okay, and again, I think it is difficult to know exactly what the impact would be on Ed and Linda, because we don't know what their family situation is, what their friends, church, or other community services might be available. I think so let me begin by talking first about SSI, SSP. There was a reduction in SSI, SSP grants for couples. They were reduced to the federal minimum. So our assumption here is that Ed and Linda receive $1,400 a month, which is the maximum grant for a couple. And this wouldn't change with any of the further future reductions proposed, because we are at the federal minimum. The other point about SSI, SSP is that there is a federal COLA expected in January 2011. Now, the IHSS wage and service reductions have been enjoined, so if the ones that were, adopted for current year and the ones that are proposed for budget year are very similar, so assumption is that the injunction would prevent those from going into effect until there's some resolution in favor of the administration. But let me talk a little bit about what some of the effects of that would be if it were to happen. First, the effect of the proposed FI score reduction is dependent on recipients' FI score. So not knowing the severity of Ed's condition, it's difficult to say what the impact would be on him. In Linda's case, she's receiving ADHC services. The scenario doesn't indicate she's receiving IHSS, but it seems likely that if she's getting ADHC services, she may also be getting IHSS. So Ed's ability to remain at home without IHSS services, again, would be dependent upon the tasks that he needs assistance with, how much assistance he actually needs with the tasks, and what family, friends, church, or other community resources may be available to him and Linda. For example, if his needs are in the area of house cleaning, grocery shopping, those kinds of things could be performed by friends, neighbors, and family. To the extent that he is in need of personal care services such as bathing, grooming, toileting, or ambulation assistance, it seems unlikely that he'd be able to get that extensive level of service from friends or family. If his condition is severe enough, however, it seems likely that his FI score would be high enough that his IHSS services would continue.
I think it's important to note, maybe it's self-evident, that though when you say that they may be available for maybe family members available, it's also likely or possible that there won't be family members.
Oh,
available.
absolutely.
Yeah.
You know, and I'm just saying that we don't know without knowing more specifics about their situation.
Wanted to point out it could go
Yeah.
either way.
Yeah. So then in Linda's situation, again, if she's also receiving IHS services, if her FI score is not sufficiently high, then she would lose those services as well. So, and then on the contingency reductions, which would eliminate IHSS, again, depending on their situation and whether or not there was any other help, it seems likely that this couple might end up in a nursing home if their needs are severe enough to require nursing home services.
Okay, thank you very much. And we're going to go to Representative of California Department on Aging. There's obviously a wide range of programs that this couple would likely be eligible for. So can you talk about those?
Correct. Good afternoon, Mr. Chair and committee members. I'm Laura Conley, Chief Deputy Director from the department. Lynn Dauscher, our director, was able to be here for the previous hearing, was not able to make it today. And with me is also Ed Long, our Deputy Director for Long-Term Care Services and Aging. And Ed's going to speak to this scenario.
Hello. It got away from me. As our colleagues have acknowledged here, these people are obviously frail individuals who would most likely need supports that it's difficult to know if they would have in the community without having a greater understanding about their community resources, their family, their friends, their church connections, etc. We certainly recognize that with the elimination of the community-based services programs that we've seen this year, that there would be impacts on these individuals nonetheless. And we do know that many area agencies on aging have elected to continue similar services using other funding sources through the Older Americans Act, county funds, grants. So to the degree that those...
You looked at the degree to which that is the case? Do we have, have those?
We have done. We did a survey in November to look at area agencies on aging and what their plans were for the community-based services programs, and we are in the middle of compiling results from a follow-up survey.
Well, rather than today, but
that
following up probably in the May revised budget hearing, that is going to be really crucial information, I think, as well as trying to determine, if at all possible, the sustainability of those sources. I mean, whether that's something they could do for a little while or whether that's something that the area agencies could do on an ongoing basis.
It varies from community to the community. Through the Older Americans Act, we know that some area agencies on aging have made available a variety of care management, assisted transportation, information and assistance services that could be of help to these individuals, or in-home services such as personal care, homemaker, chore, respite. Both these individuals would also be eligible to receive meal services, either in-home or congregate meals through the Older Americans Act, and adult day services, either health care or social model services, also funded through the Older Americans Act. But the degree to which area agencies are able to do this depends on the amount of funding they have, which is limited, the number of people they have in the community who also require those services, and other supplemental funding they may have, as I said, through county or other fund sources to augment the Older Americans Act funds.
So like the earlier comment I made about the family or relatives may or may not be available,
Yes.
the locally funded services through the Older Americans Act, depending on where the couple lived, may or may not come to the rescue.
That's absolutely correct.
The other service that may be of assistance to them, depending on their functional needs, is that they may either one or both be eligible for the MSSP Medi-Cal Home and Community-Based Waiver Program. That said, though, most of those individuals are also enrolled in the IHSS program, so there's a strong linkage between the services that really do help keep those individuals who are nursing home eligible in the community.
Yeah. What we do know about people like Ed and Linda is that their care plan is comprised of a number of different services, all of which rely to some degree or another on each other to be successful in sustaining them in the community.
Okay, so the purpose of today was to talk about individual scenarios to try to humanize this, but let me just say one more time that I think in the overall budget scenario, this committee's going to need to have as good a handle as possible in terms of understanding the impacts, the information about how the local area agencies are, to what extent and where the area agencies have been able to backfill and keep services going, and also, what degree of service. I mean, is it a brown bag half as often, that sort of thing. So, okay, well, thank you very much, all of you, and I will invite Elizabeth Landsberg from the Western Center on Law and Poverty up, and we heard from Diane Kaligian at the end of the last hearing because she was unable to be here, so she talked about it from the Sonoma County Area Agency on Aging perspective. It's a shame we don't have a county agency here, though, because I think in light of what we just heard, it'd be really interesting to hear from the county standpoint how that's working and to what degree it's working. But hopefully we will be hearing that later in the budget process. So, but we are glad to have you with us today, and anything you can shed the light on and help us understand the impact on this particular scenario would be very helpful.
Thank you very much, Mr. Chair and members. So I'm going to sort of look at a couple different pieces related to cash aid and then the healthcare side. And I just want to say for a minute that if Ed were receiving SSI as an individual, the governor has proposed an additional cut to individuals. So while it's true that we're at the federal minimum for couples, we're not at the federal minimum, but the governor seeks to take us there. So Ed could see his SSI cut down to the federal minimum of $830 per month. As Ms. Baird said, the governor's proposals to cut Medi-Cal eligibility are still on the table. Federal health reform specifically prohibits states from cutting either our Medi-Cal or our Healthy Families program and puts at risk billions of dollars in Medicaid if we were to do that. We think it's irresponsible for the governor not to withdraw those proposals and would ask the administration to do so as soon as possible. People lose sleep over these things, are worried about health reform, are worried about losing their health coverage, and we find it incredibly unlikely that the CMS is going to give flexibility to let states cut Medi-Cal when we're trying to expand coverage to everyone in the country. So we hope those proposals will be taken off the table. If Ed and Linda receive SSI as a couple, they have had their grants cut 4 times in the past year, so it's gone from $1,524 a month to $1,407 a month. So I can't imagine a couple trying to live on $1,407 a month in California with all of their costs. And I think it's important as we get into some of the Medi-Cal cuts to remember that, again, they've had their income cut dramatically. If Ed were a legal permanent resident who came to the United States in 1997, he would likely not be getting SSI but be getting CAPI, our program for immigrants, and want to make clear that the governor has proposed complete elimination of a number of programs for legal immigrants, the food program, the cash assistance program, and Medi-Cal for legal immigrants. So they could lose their cash aid altogether. And it's hard to imagine what this couple would do if they've lost their cash aid. We know that there were immigrants back in 1996 when the federal government took SSI away who took their own lives. So I think it's critical to remember what we're talking about here in terms of human suffering. As Ms. Baird stated, Ed and Linda have had to go without 9 Medi-Cal benefits over the last year, no dental services except very limited FRAD services. they've had to go without podiatry services, optometry, psychology. So we don't know exactly which services they need, but it's hard to imagine a 70-year-old who doesn't need some of those services. And I can tell you from the front lines, we're hearing awful stories. We've decided to take poor people's teeth away. We literally have people who had teeth pulled in anticipation of getting dentures, and once the cut went into effect, they have not been able to get those dentures, and they have not been able to get an appeal to have that overturned. So I think the legislature needs to understand the impact of this. How can you be healthy when you can't chew? We've had people who have gone to the emergency room because they have a dental infection. We're paying for that person to go to the emergency room because we're not paying for them to go to a dentist. If they do go to a dentist, most of them can't afford to have the tooth fixed, and so we're pulling those teeth again. So some really extreme scenarios. People are either going without care, or some of them somehow are scraping together the money to pay for them. I don't know how on an SSI income. Some of them are going into medical debt. They may be signing up for a dental credit card because they don't know what else to do. People who may have had dentures previously can't get them repaired. So a huge range of services that we are not covering. And as Ms. Baird said, the governor has proposed taking away 9 additional benefits. Again, durable medical equipment, medical supplies, physical therapy services, orthotics, and hearing aids. If Ed or Linda is in a wheelchair, are we really not going to repair that wheelchair? We're not going to let them get around? If we have a Californian who lost a leg, are we not going to get them an orthotic? So again, these are incredibly serious cuts that are being proposed. We also question whether these cuts would save money. One of the cuts is medical supplies. So we're no longer going to provide, if Ed or Linda is a diabetic, we're no longer going to give them diabetes testing strips. So I don't know how they're supposed to control their diabetes. If they don't, they can't go see a podiatrist. So again, we're really tightening the screws in a number of ways. As Ms. Baird mentioned, the governor also has this vague cost containment proposal. The department has told us that they are looking at putting hard caps on benefits like prescription drugs or inpatient hospital days, or imposing co-pays, again, on this population that has so little income to begin with. Research clearly shows that people who have increased co-pays go without needed services. So again, we would question whether that's really cost-saving. Ed and Linda are relying on in-home supportive services and adult day health center services to stay in their home, and maybe it's hard to imagine that they're able to take care of one another given that they're each getting services. So there is a real concern that they would end up in a costly nursing home, taking them out of their preferred placement of staying in home and putting them in a costly nursing home setting. While I'm not able to address in any comprehensive way the issues related to the Area Agency on Aging, I do think it's critical to look again at this hearing, looking at cumulative impact, about the fact that at the same time we're taking away safety net systems, we're also taking away additional services in the community. Just one small example, the senior legal hotline used to get a small general fund appropriation that was zeroed out. So now seniors who may have had these services taken away can't get help in trying to figure out additional community resources. So the cumulative impact is terrifying indeed. Thank you for the opportunity to present.
Okay, thank you very much. I must say,
question.
okay, before the question, let me just say that it's absolutely necessary but bone-chilling information, and I think that while we don't have time today, I think to grill the department on the issue of partially completed procedures. Taking out, funding somebody's teeth being removed, but not the dentures to replace them. I think that's something that really should be looked at in the budget subcommittee hearing, upcoming hearing. So, putting the department on notice to be prepared to explain that to us when we have the time to grill you about it.
Thank you, because we've had a number of appeals pending for months.
And I've had a number of calls to my district office from constituents who have been put in this situation. So, yes, Mr. Bell.
When I was several years ago when I coached Special Olympics. I was kind of like a assistant to the assistant coach. So I was at the bottom of the barrel in terms of the coaches. And when I started it, the head coach says, "Okay, here's your straws." And he gave me a bunch of straws and he stuck them in my pocket. And he said, "Okay, when you take care of the athletes when they need to go get a drink of water." And I says, "Well, why do I need the straws?" And he says, "Well, they don't have any teeth. And a lot of their teeth, if you put cold water on their teeth, it'll hurt. So what you got to do is you got to take those straws and get a little cup, fill it up with water, put the straw in a cup of water, and let them suck the water out so they can have water when they're playing their basketball game." So that's what I did because half of them had no teeth. Okay, and that was before the dental program got added in terms of optional benefits. Now it's eliminated, and I hear a lot of people are getting these various kinds of loans to pay for their dental care. I heard one person that told me in my district they're paying up to over 20% high interest rates because they're Medi-Cal patients that don't have any income. So the loan programs are charging them, 29%. I heard 29%. What is the control? Are there any controls on these people that are sort of taking advantage of Medi-Cal patients that need dental care, that come in and have like cracked tooth and they don't want their teeth pulled, so they go out and they get these loans? What's going on with that?
Western Center actually sponsored a bill last year, AB 171 by Assemblymember Jones, which was signed into law, which put some parameters around dental credit cards and dental loans. So there are some notification requirements, there are some refund provisions, but I just want the committee to be aware that by eliminating necessary benefits, people are going to go into medical debt, and we can give people all the notice we want, but you're right, some of those, the care credit is the most common product that we hear problems about, and the interest rate does go up to the high 20s.
Very high interest rate there. Yes. And so this is like really a serious out-of-pocket expense that these people never had before, right, when they had the program, the dental?
Correct.
Okay, so that, I think that's I'd like to have some more information about what these cutbacks had an impact on the out-of-pocket expenses of people. So we're paying for them, we're sort of paying for them another way by making them take more money out of their pocket to pay for the dental care, correct?
Right. The first panel, I thought, talked eloquently about how we're pushing people into poverty and not allowing them to get out of it. And so I think, when we have families, working families who are trying to get out of poverty, who have to take out these kinds of loans to keep their teeth so they can keep a job and they can stay healthy, that's making it very hard for them to escape poverty.
When I was a Special Olympic coach, it was one of the things that upset me the most about the care for people, the fact that I had to carry those straws around. And I always remember that. And I think people ought to recognize that we tried to come a long way since then, but I think I don't want to slip back to that place.
Thank you very much, and thank you, Mr. Bell. Our third scenario is duly diagnosed mental health and DDS consumer. Veronica is a duly diagnosed consumer receiving services by both DDS and Department of Mental Health. Veronica is also a substance abuser, so I suppose you could say it's she's triply diagnosed, if she's diagnosed for her substance abuse. So I think it's pretty well known that there's a strong overlap in terms of self-medication and drug addiction relative to folks walking around with mental health diagnosis as well. So we will begin with Ms. Delgadillo. Welcome back. Glad to have you here from the Director of the Department of Developmental Services.
Thank you, Mr. Chairman and members. Let me apologize at first. I have a bit of bronchitis, so if I start coughing, I'll ask Mark to maybe fill in. So I do apologize. Excuse me. As you mentioned, Veronica is a dually, if not triply, diagnosed individual that would be in our system. Today in the DDS system, we have about 28,000 individuals who are dually diagnosed, meaning they have developmental disabilities and they are dually diagnosed on mental health issues. We do not have immediate access to data on the substance abuse side. It is in the case files kept by the regional centers, but our antiquated IT system prevents us from pulling that up at the state level. We do, as you know, have services under an entitlement, and we provide a whole wraparound of services, and to the degree that a service is eliminated in another area, if it's identified in their individual plan, then those services are provided through our system. But to start with the impacts, in the budget, in the DDS budget, as it might impact Veronica, there were approximately $334 million in general fund reductions in the DDS budget this last go-around. Looking at Veronica's situation, I believe that there are probably 4 of them that would have a direct impact on her. One is that if Veronica was receiving any type of day program, we did put into place 4 additional holidays, so there'd be 4 less days of service during the year for Veronica. The second is to the degree that Veronica is receiving social recreation, camping, non-medical therapy type services. Those services are suspended unless she has a specific and particular need that does allow the regional center to evaluate and provide the services in those cases. The third is if Veronica happens to be living with her family and her family is accessing respite, to the degree that Veronica was receiving more than 90 hours of respite a quarter every 3 months, or was receiving more than 21 days of out-of-home respite a year, Veronica's family may be impacted. The caps would apply unless there was a unique situation where Veronica needed additional services. The other area that that could impact Veronica, and it wouldn't take away her services, but part of the reforms did put into place changes related to behavioral services, which are often the services provided in our system to people that have mental health needs. What the changes require is that the behavioral service provider has to put in place a plan, and the plan has to have specific goals and specific outcomes, and the family needs to participate, and they evaluate on an ongoing basis whether or not the plan is meeting, in this case, Veronica's needs. And if it's not, they need to adjust it because she may need a different type of therapy than maybe what she's receiving. So that doesn't change or it doesn't eliminate her services, but it may change her services if the existing services weren't specifically meeting her needs. I apologize. I note in the scenario that you do mention IHSS, DDS has approximately 42,000 people that we serve that also receive services in the IHSS system. I'm assuming from the reference on here and my colleague joining me at the table that she may also be somebody that was receiving services from IHSS. And to the degree that that is true, and my colleague can talk more about the specific reductions, but to the degree that those services were reduced and Veronica's individual plan identified she still needed them, those services then would be accessed through our system. The area of mental health, in particular the area of mental health and DD, has been one that the legislature and our system has been concerned about for many years. In 1998, there was a statutory requirement put in place that the regional centers and county mental health have to enter into and keep updated an MOU every year that talks about how they're going to work together and provide services. It also requires that the departments submit to the legislature annually a report, which the last one we sent was December of 2009, and it lays out by regional center the different types of mental health services that have been accessed, whether they're generic or whether we're paying for them separately, and it identifies issues and areas of concern. Clearly, with or without the budget reductions, we have a lot of room for improvement in the area of DD mental health services. A lot of it relates to training and finding providers that are familiar with the DD population. As a result of the legislation and as a result of money we get from Prop 63, we get $1.4 million, and actually, depending on what happens with Prop 63, that may go down about $300,000. But that money has allowed us to bring together county mental health and regional centers in joint training efforts as well. So clearly an area of concern to all of us with or without budget cuts is the need to expand services in the mental health community to meet the needs of individuals with DD. I'd be happy to answer any questions if I haven't covered something.
So I'm not sure if better to ask you, of course, with your copy, we should wait and ask the social services person.
sorry.
But what I'm understanding about the IHSS services to regional center clients is that to the extent that they are cut in the social services budget, that essentially that is just for that percentage of IHSS clients who are regional center clients, that just shifts those costs over to the developmental services budget. Is that?
To the degree that those service needs are identified in our system in the individual plan, and it may be that when the planning team looks at the individual, if they're not getting IHSS, they may identify other services, for example, day program services.
So there's a new review that, based on the regional center's processes to determine if the service, so it's not an automatic shift across because
it's automatic that they'll get the services that they need, but the team will look at how best to meet those needs. Mm-hmm.
Okay. Okay, speaking of social services, we'll call on the representative of the department now.
Well, and I'll be pretty brief. It is true that significant numbers of developmentally disabled clients receive IHSS services. The administration's proposals for IHSS reductions recognize the need to continue those services. There's a $50 million placeholder in the governor's budget to cover the cost of continuing these and other services, and through the DD system, we expect that number is going to be updated in the May revise.
Okay, thank you. Next, we have both from the Department of Mental Health, Stan Bjorn. Has it pronounced that properly?
Yes.
Okay, and we also have from the Prop 63 Oversight Commission, we have Beverly Whitcomb. Welcome, Beverly. Stan?
Thank you, Mr. Chairman and members. The Mental Health Services Fund provides funding for services provided basically by the counties. And the decision to provide services and the degree of those services is a local decision at the county level. The state provides funding commitments to the counties, and based on plans that the counties submit to the state will then disperse those funds to the counties for them to provide the services. So basically, to determine the impact of the shift in funds proposed by the governor's budget from the Mental Health Services Fund, it would be a local decision, and we could not necessarily at the state level determine which services will be impacted or the severity of that impact. There may be impacts in fiscal year 10-11. There may be impacts in fiscal year 11-12 based on the funding shifts. But the decision to change those funding shifts would be based on a discussion between the Department of Mental Health and the counties themselves. Basically, everyone, I believe, realizes that with the reduction in funding, there will be a reduction in services, but we can't really at this point quantify or qualify which services will be reduced or the magnitude of their reduction.
Well, I'm certainly glad we're going to have the representative of the county mental health directors up, because I think there might be somewhere in the state where mental health funding has not been in serious decline, not just with recent budget cuts, but because of realignment and other things ongoing. So I guess a broad, vague statement about how it would impact these people is understandable, but it certainly doesn't cover the real impacts on real people, because I think right here in this county, and probably every county in all of our districts, there's folks walking around who've lost services and drastically need them. Mr. Bell?
Yeah, I think Department of Mental Health, and I hear there's very serious problems overall with the interaction with the counties, and one of the things is, we're going through a lot of budget cuts and changes and all that, and we really have to focus on simplifying things and getting rid of the bureaucratic hurdles. And I think we should, streamline the process so that the counties can receive reimbursements in an efficient way, an effective way. So, making it harder as opposed to easier is not the direction we want to go into. We want to make it simplified. In fact, some cases we ought to just devolve the services to the counties and give the money to the counties. And one of the things I want to look at is, and I'd like to request from the Department of Mental Health, is an organizational organizational chart looking at the Mental Health Services Act, which I was very involved in, in terms of getting that passed by the voters. That was one of the major things I worked on in terms of the campaigning for that with the county governments. We really helped and worked hard to make sure that act was approved by the voters and got over 60%. And we wanted an organizational chart beginning in 2003 and every year thereafter, showing all funded state positions funded with the Mental Health Services Acts and where that money's going in various departments, the position, the responsibility, who they report to, and how the position actually benefits the Mental Health Service Act client. So I think we ought to review where the money's flowing to and where it's going overall. If we're going to have proposals regarding taking Mental Health Services Act dollars from the programs in the Mental Health Services Act and then switch them to backfill lost revenue and all that, well, we have the responsibility of having to look at where the dollars are going in the state government. So I'd like to know every dollar that's going from the Mental Health Service Act, where it's gone and what we're spending that money on. And I think we have to have that information. So I'd like to request that.
Yes, Member Bell, the department will be glad to provide organizational charts. And with your permission, Mr. Chairman, I'd like to just say a couple words. The Department of Mental Health is working very diligently with the counties to streamline the administrative processes and provide administrative relief. We have also streamlined our payment process so that claims submitted by the counties for Medi-Cal are paid within 30 days. Claims or disbursements for Mental Health Services Act funds are paid also very timely. And I believe our working relationship with the counties is a good one.
Thank you. Ms. Whitcomb.
Good afternoon. My name is Beverly Whitcomb. I'm with the Mental Health Services Oversight and Accountability Commission. And under this scenario, I'm making the assumption that Veronica is receiving Mental Health Services Act services. Okay, and so the first thing I want to point out is, unlike the DD system, unlike the mental health system, the DD system is an entitlement. So with that respect, Veronica would continue to receive services in the DD system. Again, one of the problems would be, the impact would be if MHSA were redirected and Veronica, it depends kind of on if she's Medi-Cal eligible or not, and from what I understand, most DD clients are receiving Medi-Cal. Okay. So if she's Medi-Cal eligible, at least from the mental health system, it would really impact direct treatment. There would be less coordination, less case management, less reduced coordination with law enforcement. Any county safety net services would also, be impacted to help Veronica. And she would get an increase in waiting times, and she could be placed on waiting lists indefinitely. I just would like to point out, though, if any client that does not receive MHSA services, if they're not Medi-Cal eligible, they'll basically be indigent, and that means they will show up in the emergency wards, which will be extremely costly. And that's all I have to say about Veronica.
So what I anticipated you might say, so let me, is the question of whether or not she was a client of a previous county mental health program, which was funded by traditional funding sources, or whether or not she was being served by a newly developed program under Proposition 63, that there would be potentially a difference in what level of decline in service she might experience. Is that a fair
Yes. I think counties are, and I'm sure Pat Ryan will speak to this when she comes up to respond, but counties are grappling with unprecedented cuts in, last year they lost $64 million in the Medicaid mental health managed care, and they also had a real dip in their realignment revenues. So those services, those traditional mental health services that realignment provided, are now being eroded, and the MHSA set up expectations for a different kind of care and a really recovery-oriented care. And what's happening is counties are having to go and rely on their core services to serve their most needy clients.
Okay. That's what. Thank you. I think there's some public confusion over the divergence in services, and I'm sure Ms. Ryan's going to speak to it. But you know, like like the idea that Indian gaming solved all problems for all Indians, I think there might be, or like the lottery solved all education problems. I think there might be the impression that somehow or other Proposition 63 rode to the rescue. And we know, of course, without it, things would be far worse for people with mental illness. But and it's done a lot of good. So it's not to undermine its importance, but we also have the dichotomy of the problems that county programs are facing in terms of adequate funding. So we also have a representative of alcohol and other drug programs, and I'd like to hear a comment to the extent you can help us with this scenario.
Thank you, Mr. Chairman. Dave Nielsen, Department of Alcohol and Drug Programs, Deputy Director over Program Services Division. Director Zito would love to be here. One thing she does is travel the state frequently, and she has listened firsthand what are some of the outcomes of budget cuts. She's heard it from consumers, and I wish she was here. She's with Director Mayberg at the Department of Mental Health working on the veterans issues today.
Well, let her know we would like to see her at some of the budget hearings this spring.
Great. I'll share that with her.
Thank you.
Veronica didn't come with a lot of detail in terms of her demographics, married status, whether she has a social support network. So our look at the scenario said, well, it depends, and it depends on a number of things. And it also didn't tell us where Veronica lives. So if she's in Modoc County or she's in L.A. County, her outcomes may be very different. And if Veronica's standing in line next to Mary, Ed, and Linda from the previous scenarios, we'll find that she is competing for those treatment slots that exist in our system. So the elimination of Prop 36 didn't remove people from California with substance use needs in terms of treatment and continuing supports for their recovery, but it did leave the county administrators with fewer resources to serve the same number of people. So Veronica, as she approaches the front desk or continues to get her services, she may experience an increase in waiting list if she's not currently identified. It says she's a substance user, but we don't know if she's actively seeking or getting treatment. She may find some disruptions at her service level. You know, with more people at the front door, the administrators are going to be adjusting caseloads, perhaps separating her intensity of service from weekly to every other week. We may see that type. She may not get exactly the same counsel that she needs. You know, clinics may consolidate, clinics may shore up their hours, and Veronica may not be able to get to the appointments. So we are looking carefully at all of these scenarios. We do believe that all the consumers in California will just find themselves competing for the treatment slots. We don't have any, except for the OTP cuts, we don't have any cuts before us right now. Throw in the returning veterans who are coming back with treatment needs and persons who may be leaving the criminal justice system. And we will work hard to see that Veronica gets what she needs, but she'll be in a competitive slot. Thank you.
Okay. Well, I thank all of you for presenting, and I'm going to ask the responders to come forward. The aforementioned Pat Ryan, representing the Mental Health Directors Association, and Evelyn Abu Hassan, who's a senior legislative advocate for disability rights. I don't know if Evelyn is in the... Oh, I didn't see you there. You're hiding from me. And then Margaret Dooley Samuli, Deputy State Director, Southern California Drug Policy Alliance. And if I tortured your name, I apologize. So why don't you go ahead, Pat?
Mr. Chair and members, Pat Ryan with the California Mental Health Directors Association. Thank you for inviting me to respond. Sounds like I have a lot to respond to, so I'll do my best. So I really am going to try to address the scenario and then, say a couple of things after that. And if you have any questions, I'll be happy to answer them. And I'm going to talk about the mental health and, to the extent I can, the substance abuse needs of Veronica, and let Evelyn speak to the DD needs, if that's okay. So, since Veronica is receiving services from DDS, I would assume that she's been enrolled as a Medi-Cal beneficiary, assume and hope. This would be good news for Veronica because that means she is entitled to Medi-Cal health and mental health services. However, she has lost entitlement over the past year to fee-for-service psychology services, which were an optional benefit under Medi-Cal that was eliminated in last year's state budget. And psychology services are helpful in preventing the escalation of mental health problems that require more expensive and intensive treatments for both DD clients and any clients, actually. Also, due to significant revenue reductions in mental health realignment revenues, and last year the total amount of realignment revenue reductions were about $200 million statewide, so this is not an insignificant amount of money.
And that's on top of
many
years of
everything
decline.
else.
I mean, it's been going on for a while.
Yes.
Right?
It's on top of no growth. Right. So, to actually go under by $200 million after many years of no growth is particularly difficult. That, along with last year's 50% reduction in state general fund Medi-Cal managed care funds to county mental health plans for managing the Medi-Cal specialty mental health program, has left many counties with no choice but to close community clinics that may have been more accessible for people like Veronica when they had a mental health crisis or other mental health need. Waiting times for non-crisis services have also become longer in many counties due to the reductions in county and contract providers who provide Medi-Cal and other community services. And I might note here that the statewide maximum allowance for Medi-Cal services under the mental health specialty mental health program have been frozen at the 06-07 levels, so contract providers are having a more difficult time in being able to continue to provide these services. Since Veronica also has a substance abuse problem, she's probably finding it very difficult to find treatment for her disorder, since the types of services available under drug Medi-Cal are very limited and do not include inpatient treatment. She may be able to access some treatment for her co-occurring substance use disorder and mental health disorder through co-occurring disorder services from county mental health, using primarily Prop 63 funds, because that really is the only funding source that gives us the flexibility to serve people with dual diagnosis. However, since Prop 63 funds are virtually the only funds remaining for adults who are uninsured with a serious mental health problem, especially in light of the loss of the AB 2034 program a couple of years ago, which Prop 63 was supposed to build on, not replace. And since it's estimated that counties are only able to serve approximately 50 to 60% of those who meet the target population for community mental health services, it may be difficult to get her the comprehensive services she needs. On the positive side, Veronica could qualify for and be one of the lucky individuals who are enrolled in a full-service partnership under Prop 63, in which case she would receive whatever it takes in coordination with the regional center, in this case, to help her stabilize and recover from her mental health and substance abuse issues. These services overall have been shown to have tremendous outcomes, the outcomes that were intended when the act was promoted and passed by the voters. But Prop 63 funds are also on the downturn due to the poor economy, which means fewer individuals are able to be or will be able to be enrolled in such programs. Also, with eroding realignment and state general fund Medi-Cal funds, counties must increasingly use Prop 63 funds as match for Medi-Cal beneficiaries, because Medi-Cal is an entitlement program. And that leaves less money, realignment and Prop 63 money, for indigent populations. I might also note that because of Prop 63 and because it is flexible funding to do lots of the types of things that we know work for this population and many other populations with mental health needs, we have been able to work with the regional centers and work together in a DD mental health task force to come up with pilot programs that specifically address the dual diagnosis needs of people with developmental disabilities and mental health issues. If the governor's proposal to divert $452 million a year for 2 years from county Prop 63 funds to the state general fund were to occur, many more individuals in serious need of mental health services would be left unserved, and programs like the pilot programs that have been created and funded through Prop 63 would go away. If the trigger that was in the governor's budget that would happen if we didn't receive the federal funds that we needed to receive in order to avoid the trigger, it would mean nothing less than the collapse of our community mental health system in California. It would mean the collapse of the Medi-Cal program and indigent services for individuals in California, because it would wipe out the entire fund of Prop 63. I think I'll end there and just say this scenario is a very real scenario. It's not necessarily a typical scenario. The people who are the most impacted by both the erosion of funding because of the poor economy, realignment funding, and the Medi-Cal managed care funds, but also the erosion of funding of Prop 63 are people who have no insurance and have no entitlement to programs. And those are the individuals who are increasingly unable to access any kind of mental health services except for emergency room services, which, as we know, are the most expensive level of services. Thanks.
Very much. Ms. Abu Hassan.
Evelyn Abu Hassan with Disability Rights California. I want to start off by saying we've provided extensive written commentary and it'll be handed out. So I'm going to focus on the DD cuts, but am here to answer any other questions that may arise. So what I'd like to do is just talk briefly in terms of each one of the proposed cuts to the extent that we feel that it impacts the scenario here, and then try to apply it to the scenario that we've been given. Relative to this scenario, I'm going to presume that Veronica is an adult and not a child. And I'm going to start, and first of all, before I start there, I want to talk a little bit about the fact that we understand that it's a difficult fiscal situation. We want to acknowledge the department's work in bringing in some additional federal funds into our system, looking at downsizing larger facilities to allow for additional federal match, looking at the development of the individual choice budget, which will allow for some additional flexibility for our folks. That being said, the impacts of these cuts are significant. As Director Delgadillo said, it was $334 million in cuts to our system. I'm going to start by talking about the impact as to respite. So, as Ms. Delgadillo said, the respite has been capped at 90 hours a quarter. What we have seen is that there is an exception in place where respite could be increased depending on whether the increase in hours is needed to keep the consumer at home, or if there's an extraordinary event that interferes with the family member's ability to meet the care and supervision needs of the consumer. Since the budget reductions, what we have seen is that there are instances where regional centers have orally notified folks of the reduction in respite. There hasn't been notification in writing of the respite reductions necessarily in certain instances. At least one regional center determined that the cap was 30 hours a month, not 90 hours a quarter, thereby denying consumers and their families the flexibility that 90 hours a quarter provides. What we've also seen, again, folks have not always been told of the exception, and at least in one instance that we're aware of, a regional center unilaterally decided that a consumer did not qualify for the exception. In this scenario relative to Veronica, because of her multiple needs, she may qualify for more than 90 hours of respite because of the intensity of her needs and her disabilities. We would think that it's important that the individual program planning team consider the exemption when deciding Veronica's respite needs and provide appropriate notice relative to whether the respite hours are denied, etc. I want to highlight a little bit of the transportation changes and how we see this as potentially impacting a consumer like Veronica. So we agree with the fact that if a consumer can use generic transportation and least costly transportation that should be used. There are some significant impacts when consumers are no longer permitted to use specialized transportation. So if we use Veronica in this example, the requirement to use least costly transportation could be problematic for someone like her who, because of her disability, may need mobility training or behavioral supports in order to access public transit. We are aware of situations where consumers with behavioral challenges have been denied public transit because of their behaviors. If Veronica lives in a rural area, access to public transit may not always be available to allow for a reasonable commute time. If Veronica, like myself, uses a wheelchair, and I've experienced this myself, there may be limited availability of accessible seating on public transit, which would make utilization of public transit extremely difficult or unreasonable and may interfere with her ability to access services such as her day program. And if Veronica attends a specialized day program that offers unique services to meet her needs, there may not be an alternative closer to her home. So this leaves Veronica with an inability to attend the programs and the community services that are available in her community and to fully participate in the integrated community settings. Ms. Delgadillo touched briefly on the temporary suspension of certain services, these being social recreation, except those vendored as community-based programs, camping, and so forth. And these are suspended until the development of the individual choice budget. Again, we're pleased that the department is moving towards the development of that individual choice budget. We think it's going to allow for more flexibility. There is an exception in place relative to this suspension of these services. The exception allows for the service if it's a primary or critical means of ameliorating the physical, cognitive, or psychological effects of a consumer's developmental disability, or if the service is necessary to enable the consumer to remain in his or her own home and there's no alternative service available to meet the consumer's needs. Again, we're finding that families and consumers are not always told of the exception, and so we want to address that again with this particular instance. As far as social recreation programs are concerned, we want to highlight that in many cases, social recreation programs are not just recreational programs. These programs provide social skills training for many people with developmental disabilities. And what we found is that there's confusion as to whether whether regional centers are seeing these programs as actual recreation or whether they're being viewed as social skills trainings. So some regional centers are funding these programs as social skills trainings, other regional centers are not. So we wanted to make sure that we highlight that. Again, for many people with developmental disabilities, these kinds of programs are needed to address the ability to develop their skills in a group context, which they don't often have the ability to do in other settings. I highlighted a little bit about the notice issue. I just want to address that one last time and share with you all some of the things that we've been seeing in terms of actual notice that's being provided to consumers and families. We have seen a lot of problems with the way that notice is being given. There's been a failure to provide written notice and only providing oral notice. I think I talked a little bit about that. In many cases, families aren't told about their right to appeal. There's been some challenges in clearly stating what specific services are being terminated, reduced, or changed, or why. This includes explaining the legal basis for such an action, as well as the factual basis for such an action. There's a failure to note whether the person is or is not on the home and community-based Medicaid waiver. We've seen instances where there's a failure to note when the effective date of the proposed action will take place, and again, in lack of information to the individual that he or she has the right to appeal and may do so for up to 30 days from the date of the notice. And if the person files within 10 days of receiving the notice, they may also be able to get aid paid pending. Beyond that, there's also issues for families that are non-English speaking. So when you have a family that doesn't understand English and they're getting their notices in a language that they don't understand, They are not going to be able to often understand the complicated information that's in that notice because it's not in their language. We've worked hard to try to remedy the notice issue, and especially for those less sophisticated clients and groups of clients. And we would encourage the department to provide some additional oversight in this area. In our written testimony, we talk about all the other cuts that are also affecting our community. I'm not going to go in that in a whole lot of detail, but our clients, our consumers and clients also receive Medi-Cal, they receive Social Security, they receive IHSS. Ms. Delgadillo highlighted a little bit about the backfill with IHSS if it's eliminated. We're not sure how that will play out in reality because it is our understanding that the regional centers don't typically provide that type of service. So how that actually plays out in reality and how it would affect, at least in the transition phase, an individual, we're not quite clear. And often if you are looking for in-home supportive services and it's going to be backfilled with the regional center, there might be a lag time, at which point that individual may end up institutionalized until that service is available to them. So I'll close my comments there, but if you have specific questions, I'm more than happy to provide answers.
Okay, thank you very much. And another budget question for a later time will be how the department is going to budget for these services through regional centers, apparently not knowing yet when and how much IHSS-type services will be provided to the client, or whether or not the regional center will think that something else could suffice rather than home care. So, question that we can not deal with today because of time, but definitely needs to be discussed. Did you want to? I'll wait till the end. Okay. Well, thank you very much, Evelyn. And we have Margaret Dooley Samueli, who's the Deputy State Director for Southern California Drug Policy Alliance. Okay.
Yes, thank you, Chair, members. For a person like Veronica, she's facing, as we've heard, multiple challenges given her triple diagnoses. And you've also gotten a sense, I think, already for how disjointed the services that she needs are in the state of California. And I'd like to speak specifically to her substance use disorder needs. Veronica is probably not going to be able to access addiction treatment in California, given the state of treatment. State funding for treatment has fallen by almost half in just 3 years. We still do have federal funding, but it's been on a downward trend for 10 years. Counties are desperately trying to keep treatment providers open. It's especially important to protect those conditional use permits at local level. When these programs shut down, it's a long-term loss. So even where funding becomes available in the future, Veronica would not be able to access it because it just wouldn't be there. The state was able to use some federal stimulus dollars last year to shore up treatment. Those are burn grant dollars. $45 million was injected into the treatment system in California that is already being used. But again, it brings treatment. It doesn't even really maintain treatment. It's still a major loss. And what happens when treatment funding is cut is that people are referred to treatment, and what they actually get is a waiting list. And I think someone already mentioned that we're talking about, even if she's Medi-Cal eligible, which we assume that she is, she's put on an indefinite waiting list. That's not treatment. That's not receiving treatment at all, and that's if she's Medi-Cal eligible. And if she is signed up for it. When people are actually entering treatment in the state of California right now, if Veronica is so lucky, she's not going to get the level of care that she needs. We are knowingly going to be making a treatment decision based on what our budget allows, not based on her needs. People are not receiving what they need, they're receiving what's available, and the fact is there just isn't much of that. If she's single, she's not going to get to get treatment. If she's pregnant or has a child, she might be able to get treatment through CalWORKS or Medi-Cal, maybe, but we've heard how those programs are being cut back. Because she's accessing so many systems, she's going to be potentially turned away from one door and sent to another multiple times. She's very likely to fall through the cracks. And unfortunately, there's one system that won't let her slip through the cracks, and that's the correctional system. She becomes very high risk for incarceration, or at least in negative interaction with the law. And this has long-term ramifications for her and her family. If she is sent to jail, even if she spends a very limited time in jail, she will very likely be unenrolled from Medi-Cal. She will come out disconnected from the systems that she was connected with and face the challenges of reconnecting all over again. If she is sent to prison, not only is prison life-threatening for people with substance abuse disorders because of infectious diseases there where drug use continues, but any ID that she has will be confiscated. She will again be unenrolled from Medi-Cal. Any children she has or family, any children will be entered into child welfare system, and she will come out much worse off than when she went in. And it's worth noting that the corrections agency itself has cut treatment both behind bars and on parole. Most likely, if Veronica were sent to prison on a low-level property offense or disturbance or for the crime of her addiction, directly drug use, then she will most likely be deemed nonviolent, a low risk to the community, which would put her at the lowest priority to receive treatment behind bars. She would most likely be placed on non-revocable parole. The corrections agency has determined that they will not provide any services to people on non-revocable parole, so she will be released back into the community with no supports or connections whatsoever, and even reduced access to treatment than she had before. So it's not a good state for Veronica. 10 years ago, even 3 years ago, if she were brought into the system because of a low-level drug possession offense, she would be eligible. Well, she's still now to this day eligible to receive treatment instead of incarceration. But because funding for Proposition 36, the treatment instead of incarceration law, because that funding has been eviscerated, cut by 90% in 3 years, she would be. Her defense attorney would be placed in the very difficult position of recommending she take Prop 36 and be placed on an indefinite waiting list where she faces very dim prospects of success, or recommending that she take the jail or prison time and deal with all those consequences that I mentioned. So this is a very high risk, Veronica's very high risk for ending up in this situation, and it's very frustrating that as we see that the federal healthcare legislation makes grand statements about parity and treating drug use and addiction and mental health issues as the health issues that they are, we see California unfortunately de-emphasizing that and moving in exactly the wrong direction. Thank you.
Okay, I thank you very much, and I thank all of the presenters. I think we have succeeded in putting a human face to the extent it's possible without the individual standing before us. I think it's helped to move us away from a purely mathematical, budgetary calculation and a little bit more into the realm of seeing the humanity and the impact. It doesn't make decisions any easier, but I don't think they should be any easier, quite frankly. I hope that this will help inform the budget hearings going forward and into the May revise. We will remember and retain much of what we've heard today, because I think it should help to inform our discussions about the specific budget proposals as they are heard by this subcommittee. So, any other members want to comment or question? Mr. Bell?
I think one of the thing that's happening with somebody like a Veronica is to develop a more coordinated managed care approach to taking care of somebody like a Veronica. Is there any one of the approaches I've heard I've heard a lot of different approaches, quite frankly, on this, looking at some kind of managed care for disabled, a managed care program. One of them I've heard recently is to have just simply make it eliminate all the fee-for-service programs, put everybody into managed care, and then bid out managed care to health care providers and say that we're going to cut the budget, but you can go ahead and bid on this and have an open bidding process. That's one idea. Another idea is to develop specific kinds of wraparound programs at a local level. What kind of approaches have you heard that would help a Veronica the best? And maybe you can comment on that.
I'll just take a shot. I mean, one of the many things we've learned from both AB 2034 and Proposition 63 is the value in being able to have flexible funds to do what it takes to actually serve the wraparound in a wraparound way the needs of individuals, and not stick them into a category that they may or may not fit into. So we know, I think we increasingly know through pilot programs, like I mentioned earlier, what types of things are helpful and are effective in dealing with somebody like Veronica. What we don't have is enough funding to do that, and or the confidence going into the future that funding will continue. So I think we know things that we didn't know before. We're always learning, and I think that we should recognize and memorialize cost-effective treatments and evidence-based treatments going forward, so that we don't lose what we've learned.
And can I just add to what Ms. Ryan just said? Mental Health Services Act funding has allowed for some innovative programs that are not available in other systems. And so, especially for a person with developmental disabilities, there are instances where they can't always access those mental health services that they need. And if we see that shift happen with mental health services funding, you're going to lose those innovative programs that are so critical for folks with disabilities.
Another question that comes to mind, sort of similarly, but over on the DDS side, that, again, I don't know that we have an answer for today, but either in conversations with the department and or the regional centers or in the subsequent hearing, the question of a regional center client who has serious needs for services in the other areas, and those services are not available since there's not an entitlement and there's been a decline in funding. How does the regional center serve that individual for their developmental disabilities needs while there are other things that are interacting that clearly would be obstacles to adequately treating the needs of the developmental needs of the person when they've got a untreated mental illness or addiction, So it seems like that's a real dilemma on that side around about whether or not there's a way to wrap services around the person. I don't think there is, but I'm interested in knowing how the regional centers cope with that kind of a dilemma that increasingly we present them with as these budget cuts go forward. So, okay, well, thank you all very much. Even though we're, as usual, running late, I think mercifully it'd be good to take a 5-minute break before we launch into the budget items. So. I think so, yeah.
You want me to, those two students want me to read those letters?
Sure. I gave them to you. Yeah, we will.
You throw them away?
No. What kind of a guy do you think I am?
Do you want me to do that?
Sure. Sure. No, I think it's very meaningful.
They're very...
Yeah, I quickly read them, but it's...
Yeah,
We're going to get started again. So, next on the agenda is the Department of Aging. We heard the impacts of the drastic general fund reductions taken in aging for 2009 and 10. Of serious note in the aging area is that the legislature took action to reduce, not eliminate, all general fund from the linkages program and the community-based services program. We sent a budget agreement to the governor after heated and extremely difficult negotiations, and the governor consequently unilaterally executed vetoes to build up the reserve, and I think executed is the operative term. This was not part of the agreement, and the cost in the aging areas was a dismantling of small but valuable programs. In the absence of the legislature again bringing up this issue for discussion and taking some action to restore the cuts that were vetoed, this would not have even been a viable subject for 2010-11 budget. With that, I'd like to ask the Department of Finance to briefly testify to the vetoes the governor took last year, reviewing those for the subcommittee and the public, and ask the LAO to please respond briefly on these reductions as well.
Good afternoon, Mr. Chairman. Tom Williams from the Department of Finance. The governor's 2009-10 budget and May revision proposed general fund reductions to the linkages program and other community-based services programs. As reflected on the chart on page 4, the legislature took action to adopt some, but not all of these reductions, totaling $4.2 million in the budget bill. The governor vetoed an additional $6.2 million, including $405,000 in the brown bag program, $4 million in the linkages program, and $1.6 million in the Alzheimer's Daycare Resources Centers. This left approximately 3 months of funding for these programs. These vetoes were difficult but necessary to reduce the state's structural deficit. They were consistent with the governor's May revision proposal, which contained general fund reductions to many non-mandated programs in order to balance the budget and maintain a reserve for economic uncertainties. Given the continued budget deficit, the administration did not propose to restore general fund for these Department of Aging programs in the governor's proposed 10-11 budget, and we cannot support the staff's recommendation to augment these programs now. However, we will provide technical assistance to your staff to record any actions adopted by the committee today.
Does the department have anything to add to finances?
No comment.
Okay. I guess the question I have for finance, and if the department has a response, and then I would like the LAO to respond, is okay, it's a given. The governor vetoed, and at least so far the courts have upheld his authority to do so. How do we rebuild the programs in the future if we don't have if we don't maintain some infrastructure, some semblance? Is there an assumption in the governor's action that this is it, or is it viewed as necessary action to get us through this current period? And if it is viewed that way, as something one would hope we'd rebuild in the future, how does an absolute elimination over several years' time help position us to possibly reinstate these programs in the future?
The reductions or the vetoes weren't, a reflection on the value of these programs and the services they provide. Like we had said, it was more due to the state's budget situation and the kind of limited ability of the governor to make reductions in just non-mandated programs. If the state's budget situation approved, that they would be looked at as candidates for additional general funds. So, like we said, it's more a reflection of the budget. It wasn't and it will depend on the state's economic condition whether or not we propose them for funding in the future.
Well, since I haven't heard you make reference to any analysis of whether or not funding at some minimal level would help to rebuild the programs in the future, I assume that analysis has not taken place.
That is correct.
Okay, LAO, have a response?
Thank you, Mr. Chair. Jenny Bello with the Analyst's Office. We were actually able to get out and visit 3 of the local area agencies on aging last week. We went and visited Sonoma, Napa Solano, and also Marin County, or Marin AAA Area Agency on Aging, and really noticed that the reactions to the reductions really varied by location and by program. You really saw big differences in how they were reacting to the eliminations of the programs. In some cases, the program was eliminated as of October 1 because there was no funding left. In other cases, the local areas were able to somehow gain funding by doing their own fundraising or looking to other programs to sort of backfill this cost. For the most part, though, when they're using federal funds to backfill the program, it's important to note that they're not always backfilling the exact same program that existed prior to the reduction. So, for example, when you look at some of the survey data that's included in your agenda, and it notes that 17 linkages programs still exist, it's important to note that they might not be the exact same linkages program that existed prior to the reduction. They may be serving a different group of clients because of different restrictions on the federal funding streams that they are using to fund those programs. Also, they may be funding a very scaled back version of the program. It may not be the same size as it was prior to the reduction. I think one theme that I noticed throughout was that even those programs for which they were able to secure some sort of funding in the short term, on an ongoing basis, it's difficult to predict exactly how many of these programs will be sustained. So as you get further and further away, that infrastructure does break down. So it will be an ongoing effort to continue to monitor these programs. With respect to the staff recommendation, without prejudice to the merits of the program, we are not recommending the restoration of these funds at this time, given the general fund condition. However, if you do decide to restore these funds, we would recommend doing so as a block grant, which would allow the local area agencies to decide which programs to reinvest in according to their local needs and priorities. This would also allow those local agencies who have been able to fundraise or secure some money for some of these programs that have been eliminated to reinvest the money in other programs, not the ones that they may have restored funding for in the short term.
Did you, in light of my earlier question, do you have any observation with regards to the sustainability of the local backfilling of some of these programs by the area agencies?
I think that's the big question, is on an ongoing basis, it's very difficult to say how much of this additional funding that they may have been able to creatively secure in the short term, they will be able to maintain in the out years. And as we get further and further along, some were only able to secure funding for maybe another month or two. And so it might not be captured yet in this survey what the ongoing impacts will be. What is your thought, or have you done any analysis on the question of whether or not completely defunding the state's participation over several years' time on an ongoing basis either helps or doesn't, or detracts from our ability to reestablish the programs when there's restored funding? I don't think it helps. The further we get away from it, the more the infrastructure would break down. Okay, thank you. Well, it's for several reasons, I'm going to move and ask the committee to approve restoration of some of these programs. One is the reason I just stated, which is I think that there's a greater potential to not have to completely reinvent the wheel if we've kept some infrastructure in place. And secondly, in the big picture of the budget, I know this is a cliche that gets used in insider talk, but it's budget dust. It's the quantity of dollars involved is of such a small nature that it's hard. And on the other hand, clearly the impact on those who benefit is so significant for such a small amount of money that it's hard, in fact, impossible for me to sit here and support those cuts on an ongoing basis. I have no idea whether we can bring the governor along on that concept, but I think we need to try. So. The motion would be to reverse the vetoes from the 2010-11 appropriation for the linkages program and the community-based services program to align these appropriations for the budget year with what was sent to the governor by the legislature in July 2009. We direct staff to work with the Department of Finance and the LAO on the technical aspects of realizing that change. So that would be the motion. Do I have a second? It's moved and seconded. Want to call the roll, and then we'll add on other members, I hope they return.
Chesbro?
Aye.
Bell? Delatorre, Emerson, Nastandi, Blumenfield.
Okay.
That's 2.
Thanks. On the other items here, given the hour, I just want to say the others that to come forward. We don't need full detailed presentation of all the issues because I think we've heard much of them. So let's see. We're on issue 2, a Medicare Beneficiary Outreach and Assistance Program. That's on page 7 of the agenda packet. So briefly, Department, want to present?
I'd be happy to speak to that. The question that was asked in terms of our Medicare Beneficiary Outreach and Assistance Program, our MIPA grant, federal grant, the performance benchmarks are very clear from the federal government, and there are only 2, and that's number of applications received for the low-income subsidy program and the Medicare Savings Plan program. And those are both programs that assist Medicare beneficiaries who are low income and either paying all or part of their Medicare Part D prescription drug premiums. Right now, we're at almost the 9-month point into the grant, and we are at 38% of our 2-year total, so we're actually doing quite well, particularly given that some of the counties had a little bit of a slow time in terms of getting their approval for their startup of their programs, the budget for their programs. And a number of the programs actually waited until after the open enrollment period for Medicare before they really started to focus in on this project. So that was really a start date in late January, early February. So we're tracking actually a little bit ahead of our overall progress, and I think are doing quite well. We've been in ongoing contact with the project office for this grant that CMS authorized, and they are very pleased with our progress to date.
Okay, I'm going to recommend approval of $672,000. Oh, I'm sorry, I need to call need to call on finance and the LAO before I do that. Finance, you have a comment?
Yes, we are supportive of this proposal, and do note that the department has demonstrated real progress towards meeting this, and we don't think there's any problem meeting the 2-year requirements.
Okay, any comment from the LAO?
We have no concerns with this or the next proposal.
Okay. Any public comment? I'm going to recommend, make a motion to approve $672,000 in related 2010-11 federal funding authority for the Department of Aging to allow the state to draw down these grant funds from the federal government. Second, it's been seconded by Mr. Bell.
Chesbro?
Aye.
Bell? Delatorre, Emerson, Nastandi, Blumenfield.
Mr. Emerson is here, so.
Sorry. Emerson.
Aye. Emerson, aye.
Has 3.
Okay, that has 3 votes. So that's out. And so next we will go to Department of Aging Issue 3. Federal grant for services to families impacted by Alzheimer's disease and related dementias. Department, you want to present?
Yes, this is also a competitive federal grant that the department applied for and was successful in receiving. It's an Alzheimer's demonstration grant. We have had a series of these over the last number of years. This particular intervention, which I hate to say is called the New York University Caregiver Intervention, not the California, but be that as it may, has been very successful over the last 18 years in helping to spouses to keep family members at home who have high degrees of Alzheimer's disease. We plan to implement that here in California with these grant funds. The difference in the approach will be we have a much more ethnically diverse population that this intervention will be enrolling, and we're excited about that opportunity. In terms of the questions that were raised, there is a match for this grant. It's a rather steep grant as the years progress. 25% the first year, 33% the second year, and 45% in the third year. We have historically relied on our local partners in this grant, the Alzheimer's Association chapters throughout California in this case, to make the local match. And fortunately, those chapters were able to receive a foundation funding from the Harry and Jeanette Weinberg Foundation that's already in hand that will provide the match over the coming 3 years. We were also asked to what degree there's an interaction between the Aging and Disability Resource Centers that lost their funding and the goals of this project. This project really focuses on a care coordinator within the Alzheimer's Association working one-on-one with spouses or domestic partners of family members who are dealing with Alzheimer's disease, and helping them to, first of all, understand the progression of the disease, the symptoms of the disease, how to cope with challenging behaviors, how to solicit useful support and involvement of the whole family, as well as informal, supports that may be available to them, know what other social service supports are available, and why participating in a caregiver support program can be useful to them, and then providing ongoing telephone support to those individuals for the remainder of the time that the individual with Alzheimer's disease remains at home with the family. So in terms of the interaction between those programs, clearly if there are ADCRC programs continuing to exist in those communities, the care coordinators or the care counselors will make referrals to those programs, and likewise the ADCRC would likely make referrals to this program as well.
Okay, did I understand Mr. Emerson had moved it? Is there a second? Seconded by Mr. Bell. The LAO indicated no need to comment. Finance have any comment? Is there any public comment? If not, call the roll, please.
Chesbro.
Aye.
Bell. Delatorre. Emerson. Nastandi. Blumenfield. Has 4.
Was that what we had talked about? Okay, I think that completes Department of Aging.
Thank you very much.
We have alcohol and drug programs up. Issue 1 is the governor's proposal to eliminate all remaining funding to the offender treatment program, and was heard briefly at the March 24th hearing. So I'd just like to ask the department to please review the proposal and its implications and share any new information you may have on the need for community-based treatment services to provide context to the subcommittee.
Yes, sir. Thank you. My name is Millicent Gomes, Deputy Director of the Office of Criminal Justice Collaboration for California Alcohol and Drug Programs. And I guess what we're going to be doing is just covering the proposal, which is to eliminate the $18 million in the offender treatment program, which equates to 3 personnel years for the Department of Alcohol and Drug Programs, and the remaining dollars in local assistance for treatment for offenders. The implications include, well, there's actually no difference in the treatment services that are required under the law, but the local level difference without state funding is reduced capacity. And the reduced capacity also leads to a decreased number of appropriate placements into treatment based on assessed need, decreased length of stay for other treatment modalities, including detox, residential, and outpatient. Also increased wait time for referral, from referral to entry of treatment, and reduced numbers of offenders entering treatment. This is consistent from what you've heard from all the other testimony from today. I would like to point out that we do still have drug court funding at about $27 million in place that funds about 153 drug courts throughout the state, and that is not proposed to be cut.
Okay, well, needless to say, overall, I mean, the chart on page 10 just says it all. It's just the complete and utter collapse of treatment availability in our state. It's I can't really think of an adjective appropriate. Maybe when we open it to public testimony, somebody will fill the gap here. It leaves me speechless, let me put it that way. Okay, does Finance have anything to add? Legislative Analyst's Office? Okay. Yeah, I'll open it to public comment. Come on forward to the mic while you're coming. I will say that this is more than just an adjective, but you know, over the years when I was when I was Senate Budget Chair, one of my greatest objections to our budget process is that we never do the analysis of avoided costs. If you spend money as an investment in a certain area, it either brings in more revenue or reduced costs. And the problem with that is there's several problems with it, but one of the problems is that a lot of times the avoided costs are 20 years down the line. So, you know, it's hard enough to, you know, get something to be thought about for next year when we're trying to score things for this year. But there is no better example of that investment than drug and alcohol treatment. I mean, the turnaround in terms of reduced costs throughout government, healthcare, criminal justice, public safety, you name it, I mean, the evidence is overwhelming. So just from a taxpayer standpoint, setting aside, you know, all the many inhumane things that are occurring because of budget cuts and the lack of consideration for the impact on the individuals, it makes no budget sense whatsoever for us to have gone where we have gone. So that's my editorial comment for the day. Yes.
Thank you, Mr. Chair. Members, Tom Renfrey with the County Alcohol and Drug Program Administrators. Thank you, Mr. Chair, for basically making my argument for me just now. I just wanted to briefly mention a couple things. We did the survey, the county survey that's referred to in your analysis, showing the local impacts of the elimination of Prop 36. I won't go through all the numbers just for the sake of time. Just a couple of things, though. On average, statewide, there are 770 fewer referrals to treatment per month, from the data we're getting in from counties. About 4,270 fewer eligible offenders are in treatment per month statewide. These are just numbers for the last 6 months of 2009. We expect those numbers to get even worse when we see the full impacts of the elimination of Prop 36 funding. We stand to lose about 75% of our residential capacity for Prop 36 offenders. So it's a pretty dismal picture, as you've said. And on the federal side, if these proposed reductions are approved, the state will fall about $48 million short of meeting its federal maintenance of effort requirement in the next fiscal year, which potentially could mean a dollar-for-dollar loss of federal funding for these programs. So it's a loser on all counts. It's a loser right on all counts. That's my adjective. And at the same time, you know, as a state, we're continuing to put over 2/3 of our drug control money into supply reduction efforts. I'm afraid that we're still trying to incarcerate ourselves out of the drug problem, and that's just a recipe for failure. So thank you for taking my testimony.
You're welcome. I am going to, unfortunately, have to step out for a meeting which was scheduled at 4:30. I'll be back shortly, but I'm going to ask Mr. Bell to preside in my absence. So,
thank you. Proceed. Yes.
Thank you, Chair, members. Margaret Dooley Samueli, Deputy State Director with the Drug Policy Alliance. I repeat everything that the Chair just said, that our friends at CADPAC said. The burden to the state of not funding Prop 36 treatment will not be felt years down the road only. It will be felt immediately. People remain eligible for treatment instead of incarceration. When we fail to provide treatment, we fail them, they are incarcerated, and that's a cost of $49,000 a year per person. I strongly urge the committee to reject the governor's proposal to eliminate funding for Prop 36 and the offender treatment program. And I would argue that last year's diversion of Edward Byrne JAG stimulus funds need not be one time. This is annual funding that the state receives. If we spend it on buy-bust programs, it costs us money. If we spend these federal dollars on treatment, it saves us money and reduces the burden on our criminal justice system. So not only do I urge you to reject the $18 million elimination of OTP funding, I urge you to spend the federal money wisely and put it back into Prop 36. Thank you.
Good afternoon, Liberty Sanchez on behalf of the California Public Defenders Association. We're already starting to see judges who are violating Prop 36 defendants because they're unable to afford program participation. In response, obviously, our defense attorneys are filing writs, and we're going to see more and more of that. We're also seeing a dramatic reduction in availability of the much more effective inpatient treatment for our criminal defendants. 80% of criminal defendants in California meet the indigency requirement for being represented by public defense counsel, which means the majority of criminal defendants are unable to afford to pay for inpatient treatment on their own. So what we're seeing and what we're going to continue to see more and more of is defendants not being able to participate in effective treatment, violating probation, continuing to use, being incarcerated, which is much more costly. For these reasons, we urge the committee to reject the governor's proposal to defund OTP and Prop 36. Thank you.
Good afternoon, Chairman Bell. My name is Steve Mulhart. I'm representing the California Association of Alcohol and Drug Program Executives. I would also reiterate my compliments to Member Chesbrough and the way he succinctly stated the issue. I have two issues I would like to add. One is I've spent about 10 years as a member of the statewide advisory group for Prop 36 and OTP. I know from personal experience that it was a very collaborative effort between law enforcement, treatment, the department, and it's a shame to see that go away, because it was a very meaningful diversion of about 40,000 people a year into treatment, and a whole lot of them succeeded. Unfortunately, there were about 8 of them in the audience earlier today that could only stay about 2 hours, but they would have gotten up here and said to you that they owe their lives to Prop 36. The second point I'd like to make is it seems to me as we implement the federal Health Care Act and implement the changes to Medi-Cal, that more of these patients will qualify for drug Medi-Cal. If we change the eligibility requirement to 133% of poverty rather than childbearing women or disabilities, we're going to have more people qualify for drug Medi-Cal funding for Prop 36 services. And it's a shame to conscientiously destroy the treatment system while we're waiting to implement the next wave. Thank you very much.
Kelly Brooks on behalf of the California State Association of Counties. I would harken back to some of the discussion earlier this afternoon, and one of the remarks that one of the presenters made about, folks in our communities aren't going away. Certainly, we're going to continue to see the demand and the need for alcohol and drug treatment services. And because of the short-sighted budget cuts that we are making as a state, we are decimating the long-term infrastructure to be able to provide treatment services for folks with alcohol and drug treatment needs, but as well as our mental health system. And as at the same time, we're having conversations at the state level about accelerating the release of prisoners from the correction system. We're very fearful at the local level that we just don't have services available to provide folks with healthy and sustainable outcomes, and with the ability, and other services that they're going to need to get jobs. So we're very concerned about this. Thank you.
Jolene DeVorce with the Urban Counties Caucus, also deeply concerned about the elimination of Proposition 36. We were opposed to that cut last year. Counties are suffering from their own budget deficit, deferrals, and other cuts that have hurt the safety net. And as Ms. Brooks said, we're continuing to see more prisoners being released, with the idea that counties can continue to provide the rehabilitation services and programs needed for these types of individuals. So we urge you to try and find some way to restore this cost-saving program. Thank you.
Steve Kawamura on behalf of the Board of Supervisors of Los Angeles County. The board is in support of additional funding for the OTP program. Back in 2006-2007, the county processed approximately 17,000 people. We think the need's still there, and in fact it may increase due to some of the earlier releases from the prisons. Thank you very much.
Thank you. And we had a couple people that wanted to testify. They happened to be San Jose State University students that were here visiting us today. And we had about 40 students visiting us. They attended the hearing, and then they had to leave on a bus back to San Jose. But two of them wrote letters, and I'm going to read the letters because when I think they attended the first hearing and they heard the issue of the scenarios. And two of them, while we were talking, wrote these two letters, so I'll read them. The first one, dear members of the subcommittee, my name is Candace Joy, and I'm currently a student at San Jose State University. It is important to me that this committee and the governor understand how state fundings for drug and alcohol treatment saved my life. I'm a former methamphetamine addict. I have been clean for 5 years. Had I not been placed in a county drug court and mandated to counseling with youth and family services, I've never had stopped using. Currently, I'm a productive member of society. I'm attending San Jose State as a political science major. My goal is to obtain my doctorate degree and become a college professor. Had state-funded drug and alcohol recovery services not been available, I would still be struggling with drug addiction. Please do not cut any of these programs. That's one. Okay, here's the second one. Dear members of the subcommittee, hello, my name is Josette, and I want to let you know that Prop 36 funding is necessary and was essential for me to get where I am today. I had an active addiction problem for many years, and my life was going downhill. I was placed in drug court, and after completing treatment, my life slowly changed. It took a couple of tries, but soon I realized the sober life had a much more promising way to live. Since sobriety, and she gives her date, July 3rd, 2006, so I guess that's, about 3.5 years? I have graduated with double honors from San Jose City College and received a scholarship to San Jose State. I will graduate this May with a degree in political science and recognized on the Dean's Honor Roll. None of these feats would have been possible had not been for Prop 36. When we are a child, when we are children, we don't ever say we want to go to prison when we grow up, but many of us do make mistakes. It is imperative that drug courts receive funding because there are many people like me who need programs and that allow them to see their true potential and contribute to society as well. Thank you for your time. Josette. So those are our bus riders that had to leave. I think what we're doing here is today we're holding open the elimination of funds. I would like to say that I think that we ought to look at this. Might be a department where we have a total of $592 million spent in this on all the various programs of the department. If we had to pick a department where we wanted to maybe do some creative budgeting, maybe some zero, what I hear from my Republican colleagues sometime, we talk about budget kind of strategies. When I talk about zero-based budgeting and like looking at the whole program and finding out what we're actually doing, I would say this might be a department to do that. And I would question, if you're going to cut these programs back so much, why do we have a department? That would be my question. Why does the state try to pretend that they really care about this? Why don't we just eliminate the department altogether? Why do we have a department? And quite frankly, with these kind of cutbacks, it might be something that's going to be in my mind when I go ahead with this department's budget, because if you don't want to fund programs that help these young ladies and others, why do we even have a department? So it's a question. If that's where we're going to leave, that's the kind of legacy we're going to leave our state, and when we're only here for a short period of time, why do we want to leave this kind of legacy for people to see? And it's all out there, and we remember for ages. We're going to eliminate these programs that the voters approved. So that's sort of my comment on that one. And I don't know if anybody else, Brian, do you have any comments? No, sir. Okay. Okay, why don't we go to the next issue, which is number 2, substance abuse prevention and treatment funding, maintenance of effort requirement. Do you have a report on that one?
Good afternoon. Susan Lucier, Deputy Director, Division of Administration at the Department of Alcohol and Drug Programs, and I will be providing you with a brief overview of our SAPD block grant MOE requirement and our current situation. As you're aware, as a condition of receiving and maintaining our SAPD block grant funds, we need to meet our SAPD MOE requirement. In September of 2009, when we submitted our grant application to the federal government for the first time, we indicated and reported an $11 million MOE shortfall, related to the expenditures that were in fiscal year 2008-9. This shortfall was due to the increased ARA fundings that were received relative to the FMAP change related to the drug Medi-Cal program, which resulted in a corresponding reduction in general funds, which are part of the MOE that we would normally count. In November, right after submitting the application, we submitted a waiver to the federal government asking for a waiver relative to this MOE shortfall. We did meet the criteria for a waiver, and in January, SAMHSA did provide us with approval for our waiver request. Now, what's included in the governor's budget for 2010-11 is an MOE shortfall of $96 million for fiscal year 9-10, and $48 million in fiscal year 10-11. These shortfalls are related to the Prop 36 and OTP reductions and some carryover of the ARA situation. We do anticipate submitting a request once again later this fiscal year after we submit our next annual application for our SAPD block grant. And for the $96 million, that's where we would be asking for a waiver later in the year. And we do anticipate meeting the waiver requirements again, and hopefully in the early part of 2011, we would be successful in obtaining a waiver approval from the federal government. The $48 million for 10-11 would be reported to the federal government, and a waiver again submitted for the following year.
Okay.
Do you have any questions?
Any others, comments? Department of Finance? When you request the waiver, do you coordinate the waiver requests from the other waivers that are being negotiated with the federal government?
No, it's an independent request. I believe
mental health or yes. The other?
We do not, because it's a very different MOE waiver requirement. I think each of them have their own individual requirement. So no, it is not coordinated. We submit it independent.
Does the federal government allow the waiver to include funds not just from the state, or local and other funds allowed to be used in the matching requirement for the waiver?
The waiver MOE expenditures are based on the expenditures of the single state agency, which is the department. So no, our requirement does not allow us to include other expenditures other than the state non-federal substance abuse expenditures for the department.
So the federal government is in no way in any other state allowing non-state government funds to be used to match the waiver money. That's not allowed anywhere in the country.
No, I'm not saying that. I'm just saying that relative to the SAPD block grant,
right?
That is our understanding, yes.
I think you ought to look into that.
Okay, we will do that.
What other states are doing, because quite frankly, there's a lot of different things going on in other states that are being used more creatively than ours, and I think we need to start being creative. This is a budget year. We need all that creativity to be flowing.
Mm-hmm. Okay, we will look into that.
Mr. DeStandy, I think this is a no action. We're going to review this after the May revision, and is that correct? Okay, now we have issue 3 of the Women's, Children, and Residential Treatment Services Please report.
Dave Nielsen, Program Services Deputy Director. The item before you is related to our captain programs, which is the California Perinatal Treatment Network. Currently has 8 providers of service. The funds flow through the counties that oversee these contracts. I believe the question before the department, we provided you first of all with a list of the providers and the number of persons served in the last year that we have complete data for. One of the questions that you have was, I think the members have that in front of you? Yes? Okay.
Yeah.
All right. The one provider closed in 08-09 when the county of San Luis Obispo terminated a contract with a provider called Paso de Vidos. At the same time, the department, ADP, was working with that provider to address some deficiencies that our staff had noted, but the county went forward and terminated that contract. We returned to the department and looked at the Budget Act language, read it with our legal staff, our admin chief, our deputy director, chief deputy director, and upon reading the Budget Act language, felt that we had no recourse to distribute the funds that had gone unused. That's where we stand today.
Okay. Other comments from the Department of Finance?
Well, Marvin Dion, Department of Finance. With the closure of the facility in San Luis Obispo, we assumed the savings. Those savings are reflected in the governor's budget, and we assume the savings going forward into the 10-11 fiscal year.
So yeah, the money was allocated to this program, and then just because it said 9 rather than 8, the money's what happened to the money?
Those dollars were never allocated to another program, and they're
still there.
Yeah, they're scored in the governor's budget as savings for the 9-10 fiscal year.
This is savings. He scored that, but the budget appropriated the money, right?
Yes, for 9-10 they are appropriated.
All right, so their money's there then. The staff is recommending consideration of adoption of amendment to the provision 2 of item 42000-104-001 of the budget bill for 2010-11 to delete the word 8 with the intention of having appropriation apply to all existing providers with the amount appropriate raised to the original allocation of $5.767 million for these remaining providers.
So moved.
There's a motion, a second. Is there any discussion, any testimony on this? Call a roll.
Chesbro? Bell?
Aye.
Delatorre?
Aye.
Emerson? Nastandi?
No.
Blumenfield has 2.
Thank you. Okay. We'll go on then on the next item. We'll thank you. Department of Community Services and Development is item 4700, issue 1. And then we have the Department of Rehabilitation last, so that's the last item.
Sorry about that. Good afternoon, Assemblymember Bell and committee
welcome.
members.
Thank you.
My name is Maria Caudill, and I handle legislative and external affairs for the Department of Community Services and Development. Before we go ahead and proceed, our director would like to extend his regrets for not being able to be here today. He had a long-standing prior commitment and unfortunately could not reschedule. We do have here today with us is Jason Windley, who is our chief of the Energy Division and will be providing a quick update on our ARA program, Weatherization Assistance Program. And if you happen to have any questions regarding the department's budget, we do have Lisa Mastrati, who is our Chief Financial Officer. Jason?
Hey, thank you, Maria. Good afternoon, Assemblymember Bell. My name is Jason Wimbley. I'm the Energy Division Chief for the Department of Community Services and Development. I'm pleased to provide the committee with an update on the department's implementation of the department's Energy Recovery Act, ARA, Weatherization Assistance Program, and a brief overview of the steps that we have taken to strengthen our oversight of the ARA program. I believe the committee received a copy of the quarterly highlights I'll be speaking to in my testimony, and if you don't have copies, I have extras here for you. In the interest of time, I'll briefly touch on a few key items. First, under the Recovery Act, the department received approximately $185.8 million in DOE ARA WAP funding. The department's first allocation from the grant was approximately 50%, or $93 million, which has been used for state and local ramp-up activities, including the development and training, including the development and delivery of training and technical assistance services, monitoring and oversight activities, and to fund local weatherization services. I want to assure the committee CSD is on track to reach its production goal of 12,900 units, weatherized units, which will trigger the receipt of the remaining balance of the grant by the end of September 2010. CSD's deliberate approach to the implementation of the ARA programs, addressing providers' concerns and ensuring that the necessary federal guidelines was obtained to avoid Davis-Bacon liability, built a solid base from which our provider network is able to move forward. As of March 31st, 2010, the number of dwellings weatherized in California totaled 2,934 units, with an additional 1,174 units in process and an additional 1,864 units assessed and scheduled for production. This production total represents approximately 75% of the quarterly goal for this quarterly period, which was to yield 3,912 units, and reflects the contributions of two-thirds of our providers currently under contract. With approximately 70% of the contractors in place and with key service areas in the final stages of negotiation process, CSD is putting a major focus on aggressively monitoring production. That oversight, coupled with the addition of providers with recently executed contracts that are gaining production momentum, and with large municipal providers coming online between late May and June 2010, our production numbers will continue to grow. To date, 32 contracts have been executed out of the 41 currently designated ARA weatherization service areas in the state. I want to point out that the total number of 32 contracts represent service areas and/or contracts that were consolidated since January 10. Those areas that were consolidated included Santa Clara County, Los Angeles, and Humboldt and Modoc counties. In addition, we have 5 contracts that are pending execution within the areas that include Inyo-Mono counties, Mariposa counties, Siskiyou, Santa Clara, and San Mateo counties. In the past few months, CSD has pursued an aggressive strategy to identify potential providers for the 4 service areas not under contract. Currently, we are in advanced stages of negotiation in each of these 4 areas, and we anticipate that all of these agreements will be in place by June. And these areas include Los Angeles, Area A, which Los Angeles includes 4 designated areas, San Francisco Bay Area, Alameda, and Alpine and El Dorado counties. I just want to thank the committee for giving me the opportunity to provide this update, and I'll be happy to take any of your questions.
Any members have questions? Mr. Nastandi does.
Thank you,
Brian?
Mr. Chair. Could you please walk me through the process, and as the money is sent down to Los Angeles, for example, who then distributes the money? How do they take applications in, or how does the money flow from there?
Once we have a secured contract or an executed contract with a local provider.
And who might that be? What's an example of a local provider?
Local providers would include nonprofit organizations or local city or county governments. And in the example of Los Angeles, we have, as I mentioned, 4 separate areas. 3 of the 4 areas are administered by private nonprofit organizations, and one of those areas will be serviced by the City of Los Angeles Department of Water and Power. And
Can I ask you there for a second, if I might? So DWP do they take a cut then for overhead, or what happens if they're executing the contract?
Well, the contract, with the contract, it comes with funds for administration, support, and direct program services. So essentially, the contract will provide funding for all of the activities that need to be carried out.
Is that a set amount of a certain percent of the contract for administration?
Yes.
For all contracts?
For all contracts, yes. And essentially those contracts will fund the various activities, which includes outreach, marketing, service delivery, and administration.
So you don't have applicants that come to ask for money, you go out to find them then? When you say marketing, you're marketing to say, we want to weatherize your home, or what are you doing?
Well, in the case of well, there's a variety of different marketing strategies and approaches that are utilized by the providers. Many have close contacts or relationships with utility companies. There's a component, there's a companion program that we administer, which is the LIHEAP program, which provides utility assistance as well as weatherization. So typically, clients that are in need of energy assistance, whether it be for weatherization or cash subsidy benefits, or referrals from the utility companies, those are the leads, and that's the type of marketing efforts that we will use to identify potential weatherization clients.
Okay, and then do actual workers from DWP go do the weatherization then?
Yes, the workforce that is utilized within the program includes direct hires, subcontractors. In the case of City of Los Angeles Department of Water and Power, they're going to use a combination of city employees, as well as they have fostered partnerships with organized labor, as well as job training programs.
That's my concern, actually, is that if you're just using existing Department of Water and Power people to do it, that's not a great stimulus. They're still going to be there regardless. I would like to see more bringing outside firms, as you mentioned, maybe nonprofits or some other groups to come in and do the work.
Well,
not just people that already
in the case of
have a job.
the City of Los Angeles Department of Water and Power, they have, because there's a balance that we have to meet in terms of having a workforce that has immediate capacity to meet the expectations of the program in terms of timely expenditure and services. And with the Los Angeles Department of Water and Power, they actually have a large focus on job creation and training. So they actually have employees in-house that will do a limited amount of work, but the bulk of the work will be carried out by these partners in terms that would lead to new jobs being created, as well as training.
Okay.
All right, thank you.
We're going to have comments from the auditor. Because there was an audit done recently, so you're going to give us a report?
That's correct. Philip Jelisich, Deputy State Auditor from the Bureau of State Audits. In February, we issued an audit report on both the weatherization program and the Community Services Block Grant that received the Recovery Act funding. The department recently provided us a 60-day update on their implementation of our recommendations. We generally felt that their 60-day response was quite responsive. I'd like to make 3 points. First relates to the CSBG program. In this program, as their response indicates, our primary concern related to their monitoring of the program funds. They sent us documentation that showed that they have made significant progress in improving both their monitoring instrument and their monitoring processes that they plan to be using, so we were really quite pleased with that. The one, if you will, observation or concern that I have is that while they were very good about producing a very aggressive schedule that would show that they would get out to these various places, in the prior year they monitored about 20 locations in 12 months, or thus 10 locations in 6 months, but their plan going forward was to monitor 40 locations during a 6-month time period. Their response didn't indicate that they were going to be devoting more resources to it. Maybe they were, but it raised a question about how realistic their plan was. My second observation relates to the weatherization program. As the department indicated, while they didn't quite meet their March 31st target, they would still have time to meet the goal that they set for September 30th if they met their remaining targets. And it's possible that they could do so. As I indicated, again, monitoring is going to be key, especially the inspections by local inspectors to be ensuring that the work that was supposed to be performed was actually performed. One interesting observation about the program, though, is that there was an entity that previously had a $5 million contract with them that opted out of it because of a pending enforcement action due to audit findings. That same entity now has a $10 million contract, which is about 14% of the total, to do work in Los Angeles. And again, it just seems, again, aggressive to be giving 14% of the money to a contractor that previously you weren't satisfied with their work. Now, again, adequately monitored, they might have reasons to believe it's a good idea, but it, again, I think was worthy of understanding more fully.
Mr. Chair, can I ask a quick question?
Mr. Nastandi?
Thank you. Who gave that contract to that entity?
Who was the contractor?
Yeah, who contracted with that entity that had that issue?
So the department contracted with?
Department of Water Power?
No.
So it was DWP, okay, so they contracted with that entity.
And when they went out and did an audit or monitoring of what this contractor had been doing with the monies, they weren't satisfied, and that contractor then opted out of this prior contract. But the same organization is now participating in the Recovery Act program.
How does that work? I mean, what?
If I may, I just want to make one correction. It's not the City of Los Angeles Department of Water and Power. It's actually the Maravilla Foundation is the agency I think you're referring to. Correct.
Oh, yeah.
And
what group was that? I'm sorry that you said it was.
It's the Maravilla Foundation. And
where
recently,
did they get the grant? Where did they get the money from?
From CSD. We entered into contract with Maravilla, to serve as a local administrator to the DOER grant. There was, some time ago, there was not an audit, but it was actually kind of a monitoring compliance review that was performed that called into question not Maravilla's ability to provide services, but they're an organization that operates that has a number of subsidiaries, and there was this question about how the various funds that were being operated and activities by each of those subsidiaries were being clearly delineated, and there was no mixing of the funding. We actually consulted with the Department of Energy's OIG offices, who actually before we made the decision to enter into contract with them, we consulted with them to say, well, is this something that you would okay and approve? And they did. They provided their consent and approval for us to enter into contract with Maravilla. And then most recently, the Department of Energy came back out and conducted a second follow-up review of the Maravilla Foundation and found that they had made significant changes that would improve their accounting and uses of funds, and that they felt confident, with the changes that they had made to administer the DOER program. And hopefully that will be reflected in the report that should be issued shortly from the Department of Energy, and that report should be coming within a matter of days, less than a week.
Okay, thanks.
Okay, thank you. Any other comments from the auditor?
Just one brief one.
Please.
The third comment relates to the extent to which the Recovery Act funding is weatherizing more homes than we used to weatherize, and it gets kind of to the job creation point that you made. Prior to the existence
Speak right into that microphone, sir. Can you speak right into that microphone?
Okay, prior to the existence of the Recovery Act, the department was weatherizing approximately 5,000 homes per quarter through a pre-existing weatherization program and the LIHEAP program. But the department's response, wouldn't necessarily address and didn't tell us whether or not it was continuing to weatherize 5,000 homes with the non-Recovery Act funding as well as the $4,000 that it weatherized with the Recovery Act funding. And I think that was kind of relevant to your point of, are we really creating more jobs, or did the weatherizing that was being paid for by other funding no longer continue? So the question, I guess, is, during the January, February, March quarter, did we end up weatherizing the 5,000 that we always had been doing plus 4, or how many in total among all programs?
Go ahead, you can respond.
I can respond. Thank you. During the first quarterly period, the DOE main grant funds that you're referring to have not been allocated, to those providers. Those funds will not be allocated until June of this year, and then it will run basically a 12-month contract cycle from June. So as far as capacity is concerned, many of our providers have significantly enhance their internal capacity. Even though we're still dealing with the same core number of providers, many of those providers, have quadrupled their staffing. Many have hired additional staff or hired, subcontractors to build their capacity. So those numbers will not be reflected here on this chart. It's reflected in their abilities and actions and the numbers that they're producing, which is what, is a strong indication of our ability and confidence that we're going to meet those production benchmarks that we have for the program. So the fact that, 2/3 of our providers are online and we accomplished 3,000 units within over a 3-month period, speaks volumes for the capacity growth that's occurred at the local level.
Mr. Emerson has a question. Mr. Emerson?
When you hear from the auditor about some discrepancies in the contract, do you have the ability to renegotiate that contract at that time?
Yes, we have the ability to renegotiate, yes.
And so in this instance, you did renegotiate with the contractor on
with the are you referring to the
yes,
for the Marvia Foundation? Yes. So, but to answer your question more specifically, the contractor had initially opted out, and then made a series of changes, to address the concerns that were raised, via that investigative, that compliance review that was performed. And once they made those changes, CSD verified, and then, as I mentioned before, we consulted with the Department of Energy's Office of Inspector General before we made the decision to enter into contract with Marvia. And then most recently, we verified that those changes that they've made organizationally plus structurally were in place.
But out of curiosity, why did it go up to $10 million then after it was a $5 million contract? Why did it jump up to $10 million?
Well, as I mentioned before, there are 4 distinct service areas within the Los Angeles County area. 2 of our providers had basically opted out of the program, so we needed. Well, actually, we only had.
Why did the other 2 opt out? Why is everybody opting out of them?
Well, let me clarify. Out of the 4 areas, we have 4 providers. Marvia was one of those providers that had opted out because of the issues that were raised that were not further validated or supported. There were just questions, and as a result of that, they thought it was in their best interest as an organization to not participate in the program. Also, the other 2 providers in the LA area, one voluntarily opted out, and that was early on. And it was a decision that they had made on their own. It had nothing to do with administrative issues or whatnot. They just felt that that it just wasn't a good fit for their organization to administer the grant. And then the third agency, we actually felt as a department that the agency was not administratively equipped to administer the RF funds, as well as we have terminated our contracting relationship with that entity. So with the Marvia Foundation, as well as to meet with, to comply with the expectations of the grant as well as DOE in terms of performance, we needed to, to find a capable entity that was able to provide services and administer the grant in a timely fashion. So Marvia was the choice that we made, and as a result, Marvia has assumed not only their primary area, but assumed one of the vacant areas that I had just mentioned.
we're expecting to get the recommendation is to get another update after the May revision. And so what I would suggest is that the committee members, if they have comments or questions, we can get those responses, maybe have the staff put them together for everybody and then send them to the department, and we can get some responses in May, in a month, so that we can get specific responses to specific questions and then have additional follow-up from our auditor so that we can get those responses. The staff recommends a request to the department to submit a summary update at the May revision of its progress towards responding to the Bureau of State Audit recommendations with a report on how many additional homes have been weatherized through the use of ARA funds and updated projections on outcomes to reach the September 30th, 2010 threshold as included in the California's approved state plan, and respond to, and I'll add, and respond to committee questions. And if that's a motion, we can, I put the additional and respond to committee questions.
I'll move it.
Okay, there's a motion and a second. Okay.
Bell.
Aye.
Chesbro, Delatorre, Emerson.
Aye.
Nistandy. Blumenfield has 3.
Thank you.
Thank you.
Okay, we'll go next to the next item is the Department of Rehabilitation. Thank you. Thank you, everyone. Okay, I always have to thank the last department, so thank you so much for sitting out there and waiting as we deliberate. So we'll have the Department of Rehabilitation. Issue 1 is Electronic Record Systems Project. And thank you for being here, and I'll turn it over to you.
Thank you so much, and thank you, members of the Assembly Committee, as well as others. Our director, Tony Sauer, regrets that he cannot be with us today. I am here. I'm Luciana Profazza, the Chief Deputy Director of the Department of Rehabilitation, and with me are our Budget Officer, Teresa Coriali, and Ralph Black, our Assistant Director of Legislation. And the first issue is our electronic record system. This is a system that will replace our 20-year-old field computer system, which is a legacy system, which no longer provides the necessary data to complete our reporting to our federal control agency, which is Rehabilitation Services Administration. And this new system will improve the accessibility, effectiveness, and efficiency of the vocational rehabilitation program, which is a program that serves about 115,000 Californians with disabilities annually. We are requesting $5.177 million in federal funds authority, no general fund, no new positions, for fiscal year 2010-11 to fund the 4th year of a 5-year project. And this includes system integration, testing, and implementation. The estimated completion date of the project is August 2011.
Okay. The staff recommends approval of the recommended federal funds authority. Is there any questions? If not, is that a motion?
I move it.
There's a motion and second on the approval of the requested federal funds authority for 2010-11. I'll call the roll, please.
Bell.
Aye.
Chesbro, Delatorre, Emerson, Nistandy. Blumenfield has 3.
Okay, thank you. And we'll go to item 2, which is Traumatic Brain Injury Program.
Thank you so much. The Traumatic Brain Injury Program is a transition from the Department of Mental Health to the Department of Rehabilitation, which was as a result of the passage of AB 398. The request is for $1.342 million, and these are $1.17 million in traumatic brain injury funds and $170,000 in federal funds, and a request for 2 positions. I should state that with Department of Mental Health, there was 1 full-time position, The difference in the transfer to the Department of Rehabilitation is that we will provide vocational rehabilitation services that have up until now not been provided to all 7 centers. And in order to do that, the additional position will provide that service. In addition, there are significant administrative tasks that are required by the legislation. And in addition to that, the legislation was a result of a strong community effort to transfer the program from DMH to the Department of Rehabilitation because of our vocational component.
Okay. The staff is recommending approval of a 1 permanent position and 1 2-year limited term position for the purposes associated with this request, and the second limited term position is in place of the permanent position requested by the department. Is there any questions from committee? If not, we have a motion on that.
I got a question.
Mr. Nistandi.
Thank you. What happens when the federal funds go away? How's that permanent position to be funded then?
How is the permanent position? Both positions are funded through the
fines, right?
The fines that are the seatbelt fines, as well as the vehicular fines, and the $170,000 is the federal dollars. Those are funds that we already have available in our budget. So there are no new federal funds.
Okay, and none required on out. All the fines will pay for all that.
Well, it says here that some of it's $170,000 in federal funds.
Right. These are not
$1.2 million from the fines.
Correct.
Correct.
These are not.
It breaks down like that. It's about 85% fines, 15% federal money. If they lose it. But that's why I think that's one of the reasons I think the second position is a 2-year limited term position. So it's only going to be approved for 2 years. And so they're requesting 2 positions, and their request is for 2 permanent positions, and the staff is saying, well, approve one position, but then the other position only approved for 2 years. Because of, what I think reflecting on what you were saying. So that's a recommendation.
If I could add, the request to have the second position full-time permanent rather than limited term is really focused on the additional vocational services that were not available when the program was with Department of Mental Health. And those needs will continue for as long as those consumers and people with traumatic brain injuries benefit from the program, which should be indefinitely. This is a population that has up until now not been served by the Department of Rehabilitation. About 350,000 people with traumatic brain injuries in California right now.
Are there any, is there any public comments? Do we have a motion?
Mr. Chair, Nick Buchan, Department of Finance. I would just like to clarify also that the federal funds in play in this proposal are essentially a match to the penalty account. So there's no risk of the federal funds not being there on a permanent basis.
What's the will of the committee? Second, there's a motion and second. The motion is for the staff recommendation for 1 permanent position and 1 2-year limited term position for this request. And we'll call a roll, please.
Bell.
Aye.
Chesbro. Delatorre. Emerson. Nistandi. Blumenfield has 3.
Okay, thank you. Can we have the sergeants call the absent members so we can conclude our business?
Issue 1.
4170, issue 1. Emerson. And Nistandi.
I'm sorry.
Sorry, 4170, Aging, Issue 1.
Oh,
Governor
not
Reed,
voting.
not voting. Ms. Standy, not voting. Okay.
Yeah, I think that's a good idea, Jim.
Okay. 4170, Issue 2. I have Mr. Emerson as an aye. Mr. Nastandi?
Aye.
Aye, okay.
Ms. Nicole?
And then for 4200, Alcohol and Drug, Issue 3, Mr. Emerson. I have Mr. Nastandi as a no.
No.
Okay. Mr. Emerson, no. And, okay.